And I'll call the meeting to order. This is the City of Frankfort Board of Commissioners work session for September. It is September 12th. I'll ask our city clerk to call the roll.
Commissioner Rosen?
Present.
Commissioner Unger?
Present.
Commissioner May?
Present.
Commissioner Waldridge?
Present.
Mayor Wilkerson?
Present. And that's a quorum. And first item is a ceremonial and recognition on the agenda. Do you have anything anyone wants to announce?
Oh, I do.
Right, Commissioner Rosen?
This coming Saturday is KSU Farmers Market Day. And the city will be giving away $25 gift cards. Thank you, Lisa. And they'll have special presentations on, I think, sheep and goats and pawpaw ice cream. And it should be a great event.
And the $25 gift cards are going to be for staff, faculty, staff, and students
Thank you,
with
yes.
appropriate IDs.
And also, I should add, the first day of autumn is September 22nd. So not this week, but next week. So years moving on.
And I would just like to say it was an awesome event last Saturday at the opening of Kentucky State's first football game. So those that were able to come, we were excited to have all of you guys.
I enjoyed it. It
And
was
those
great.
that were not able to come, she sent her regards. She had a sick baby at home, so Commissioner Unger sent her wills to that. But we just had a great time. It was a huge turnout. We're hoping that each year it will grow for Frankfort Day at the KSU football game. Mayor got to flip the coin at the beginning of the game.
And the
so
band was great.
it
The
was
band
good
was
just for
really
us
fun.
all to be out there, be engaged with the students and ask questions along with all those that were campaigning at the time as well. So it was a great event, and I look forward to us doing that again soon. So, yeah.
Commissioner Unger?
Yeah, let's see, I think yesterday I wanted to congratulate Ed Poe for receiving the 2022 Ruby Layson Award that promotes interfaith qualities of justice, compassion, and human kindness. And that was from the Interfaith Council.
Yep.
I want to thank Ed for all he does in the community. Also, Ruby, who the award was named after, is a great aunt of mine, and I know our family misses her, and so does the community. You know, she did a lot for the community, fought for human rights and equity for all. So.
Thank you, Commissioner. Any other ceremonial or recognition? The city manager.
So some of you may see Laura Ross and I are wearing t-shirts. This is Childhood Cancer Awareness Month. And some of you may know that we've had 2 families in our fire department whose children successfully battled cancer this past year. So we are wearing these t-shirts. You'll see our firefighters and Franklin County and City of Frankfort firefighters wearing them all month long. So wanted to point out our t-shirts. It was a fundraiser. They did all the proceeds from the t-shirt sales went to donate towards cancer research.
And thank you for that. Do we have any citizens' comments tonight? All right. I'll turn it over to our city manager for staff reports.
Yes, thank you. Jordan Miller, our senior planner, is here, who's been leading efforts for us to delve into the Soul Smart program. Soul Smart is a U.S. Department of Energy program that recognizes cities and counties and other local governments and regional organizations for making it faster, easier, and more affordable to go solar. Thank you, Jordan, for leading this effort, and look forward to seeing what you have to say.
Sure, yeah. Good evening, Commissioners. So tonight's discussion, I'll just give you a brief overview of what I'm going to talk about. Benefits of solar development. What is Soul Smart exactly, and why should we apply in other communities? What's the designation process, and any questions that you might have. All right, so communities are turning to solar energy for clean, reliable, and affordable electricity to power their homes and businesses. Rapidly declining prices for solar technologies have brought vast amounts of solar energy into the mainstream within a few short years. Participating in the Soul Smart program would help Frankfort meet its sustainability goals as identified in our strategic plan and our clean energy resolution. Notably, the Inflation Reduction Act that recently passed at the federal level will invest billions of dollars in clean energy climate solutions to help communities, companies, and individuals invest in solar. So it's only going to grow as we move on. It's not going to go anywhere, so it's something good to invest in. So just a little bit of a vocabulary lesson. Solar PV, that's what I'm going to be talking about whenever I say solar. So, right, solar is the conversion of lighted electricity using a system of solar modules that comprise solar cells to generate electric power. There's a some solar panels on a residential house and then a large array on the ground there. Typically what we permit in planning and zoning, what we see is residential rooftop solar. Typically I'd say we get between 5 and 10 a year right now. So SolSmart is a national program that's led by ICMA, the International City County Management Association, and the Interstate Renewable Energy Council, along with a team of partners with expertise in solar energy and local governments that help communities become open for solar business. So they also provide no-cost technical assistance from a team of national experts who work to evaluate programs and practices that impact solar markets and identify high prospects opportunities for improvement in your particular community. So here we have a map of that represents the location of communities that currently have SolSmart designation. The SolSmart program, they've worked with over 400 communities nationwide. And Louisville currently is the only one within the state of Kentucky that is designated with SolSmart. So why should communities apply? What are the benefits? Well, it eliminates red tape by making approval processes more efficient. That can save local governments time and money and help communities better manage constrained budgets and limited taxpayer resources. It reduces the soft costs that can increase return on investment for solar customers. These are, for an example of this, would be like local permitting requirements, which represent up to 2/3 of the cost of an installed residential system. Complex or poorly defined local government processes can add thousands of dollars to the cost of going solar, according to SolSmart. And by improving these processes for local solar, we can improve business prospects for solar companies. More than 1/3 of solar installation companies state that they avoid serving communities because of permitting difficulties. And finally, Frankfort will receive national recognition through the SolSmart website, media campaign mentions, and other means. Also provides an opportunity for us to receive awards for exceeding basic program requirements that can further distinguish us from our peers. So the designation process, broadly they define it in 7 steps. We've actually already completed step 3. The first couple steps are pretty easy, which was the consultation call with technical assistance provider on how to get the process started and what are some of the feasible requirements that we can achieve. And something that we hope to work on this fall and hopefully can achieve before the end of the year. So SolSmart, they have 3 different designations, bronze, silver, and gold. Right now we're thinking about silver status because there's a lot of low-hanging fruit that we can easily achieve and do it in a short amount of time, we feel. There are over 70 credits, 7 different categories that you can fulfill the pathways to designation, and every community is different on how they achieve that designation, so there's not one distinct way on how to do it. However, but if the board finds that gold is something we would like to achieve for, one of the things for gold status is to codify language in your zoning ordinance about solar PV as an accessory use being explicitly allowed by right in all major zones. Currently, that's not something we have explicitly stated in our zoning ordinance. We do talk about best practices and guidelines in our historic districts, our guidelines for those about solar in those areas, but not in our zoning regs. So that's something that would take like a text amendment, right? If we wanted to do something like that right now, it'd take a couple of months. But we are rewriting our zoning ordinance, hopefully beginning next summer, right? Because we're doing comp plan. Once that's finished, we'll work on the zoning ordinance. We've already signed that contract, so that is going to happen. So that's something we definitely hope to include within that. But if we'd like to do it earlier, it's something we can work on. In your, I think Shermaine may have sent you something, a memo with a solar statement, as was the attachment. That's just one of the things that, in order to receive designation or to get the process started, that we send to SolSmart. So I just provide you with an example of that for you to read over, as well as the manual, a link to that. It's about 42 pages. That gives a good overview of the program. So I'm happy to answer any questions if you got them. Sure.
Commissioner Rosen?
Is this a federal program or
Is it a federal program? I don't know if it's, is it funded
U.S. Department of
federally?
Energy money that
Oh,
went to
okay.
ICMA and other organizations.
Okay, so,
Okay.
and how long has it been around? Like
5 years,
Oh, okay.
not long.
And yeah, I think being gold makes a lot of sense, and having it in our guidelines, ordinances,
Yeah.
makes a lot of sense to tune people into the possibility.
Yeah, great. It's one of the things is having a landing page on our website, city website, about, you know, a step-by-step checklist of what exactly you need to do if you were a resident and want to put it on your house. You know, what's that process, and what do you need to do, what permits, where to go, things like
I think
that.
that's important because it takes the kind of hesitancy question out of actually doing it.
Yeah.
And
so-
knowing that, does it come with some financial help for people wanting to do it?
Does it come with financial help? No, they don't provide financial assistance, but they will help communities direct towards those opportunities that could be available once you achieve that designation.
That would help.
And there's no cost to our community to get the designation?
Not besides just
Except-
staff time.
Right, staff time,
Yeah.
the work to do that. And then the major obstacle to gold is the text amendment.
Basically.
But
Yeah.
we're going to rewrite next year sometime, we hope, and so, but yeah, I'd be in favor of going for gold, just as
Mhm.
this discussion's
I think it's
concerned.
worth it.
That's, yeah, I don't know why we wouldn't. What's the downside of getting this
Time,
designation?
just time.
Would mainly be Jordan's time, and you're in favor of the program, right? Okay.
Exactly.
Any- Yes, city manager.
Jordan, is there a letter or something that the commission needs to adopt? I'm trying to recall from conversations. Do the commission need to adopt
Mm-mm.
anything? Okay.
No, just that solar statement, that call it PR1.
Okay.
Send them that, and yeah, that's like one of the things that you can earn credits on is like presenting it to Board of Commissioners tonight. So I talked with Lindsay about that, so we could get credit points for that tonight for me just speaking to you guys about it. So you all don't have to officially adopt anything, no, but couldn't hurt, I would say.
Well, I'd like to move that we officially adopt it and aim for the gold standard.
We could put that on the voting session, is that, we'll put it on the voting
Okay.
session well, we can discuss it more, but.
Okay.
Great. We'll work on that.
Any other? Thank you, Jordan.
Thanks,
Thank
guys.
you, Jordan.
Appreciate it.
Next staff report, we have Laura Ross, who's going to speak about some possible to request to amend the ordinance setting forth requirements for how local preferences are applied in our city's procurement process.
Sure, and I had given you guys an update about this a few months ago, that this would be coming as a best practice that we would like to adopt. We think it will make things a lot easier and more efficient in our procurement processes. Basically, the city of Frankfort has had a local preference ordinance in place for many, many years, through which we do apply preference, usually in a percentage amount based on bid price or whatever it might be, to local entities. They have to be registered through the finance department and meet certain requirements. In researching some other cities, what we have realized is that most cities do have a provision in there that allows for an exception. So, if all things are equal, we definitely always want to apply the local preference. That's been our practice. But there are times, rare occasions, when it's just not feasible. And to make that something that we could do, that we could handle internally, putting a provision in our local preference ordinance that just says when due to very special circumstances, including specialized expertise, availability, quality, other things like that, particularly with professional services and other services that are just really specialized, the city manager has the ability to make a written finding that it's in the best interest of the city to not utilize a local company. And we don't anticipate that this would be used in every occasion or very frequently, but it protects everybody involved. It's a very common practice, and it still ensures that the local preference will be awarded in every other circumstance where all other factors are equal. So that ordinance change is very simple to our existing ordinance, and I sent you guys a copy of that, and we'd like to put it on for first reading at the end of September. If you all have any questions, please let me know.
Any?
I read it over, I thought it looked reasonable and a good idea.
Oh, okay.
Can we put it on for a first reading?
Sounds good.
Great.
Great, thank you. Thanks, Laura, Ross. Next up, we have Katie Beard, our Public Works Director, who has 3 different updates. Solid waste management proposed changes, some ordinance changes, but also about update on Singing Bridge and the Colin Jones contract.
Yes, so I'll start with solid waste management. I think a lot of you have heard by now, we're looking into a solid waste management fee. We've been looking at what other communities do and looking at our budget and the services that we offer and thinking about what would be reasonable for our community. And so on the next slide, I'm going to go over a schedule. I think at the October work session, we're going to be prepared to present that program to you with our proposal. But that's one of the things that we've been working hard with Laura Hag as well as Sarah Anderson and Byron Roberts. We've been working on pulling that together and getting that going. So we'll talk more about that in the upcoming months. But I just wanted to give you a brief update tonight on that, as well as later this month, in 2 weeks from today, we're going to ask you all for a first reading on some ordinance changes. So I'm going to briefly run through what those are, and then we're going to talk about possibly changing our free week, or our cleanup schedule is what we would like to call it now. From here on out, we'll call it a cleanup week instead of a free week. On the next slide, I'll just briefly kind of go over the schedule of what you all can expect as far as presentations and information from Public Works over the next couple of months. On the 26th, that's your voting meeting. We'll have the first reading on the ordinance changes and try to get your approval on the cleanup week schedule. The cleanup week schedule is actually not an ordinance change. That's just a schedule change that can be approved by the commission. On September 29th, we're going to have some one-on-one meetings with you all to go over the details of our fee proposal and kind of show you the ins and outs of what we've been looking at and answer all your questions and concerns so that we can get that addressed before the meeting on October 10th when we present our final proposal. Well, our draft proposal, I will say at this point, because we will have many months of additional study before it is implemented. October 10th is that presentation, and then November 14th, I wanted to put this on your radar as well, although it's not related to solid waste management. We will have a stormwater utility fee discussion as well. So, as we're all very aware of, we're looking at a shortfall in our revenues, so everybody's trying to come up with ways to improve that situation, and these 2 fees will go towards that goal. And then in the winter, we'll be working through our public outreach and education. And then in the spring, we would come back to you with our final proposals for both of those fees. On the next slide, this is just a picture to give you an idea. Some of the ordinance changes are really driven by things like this. This is a $25 bulk pickup. So we will pick up all the furniture, and really everything there is supposed to be in a bag or a container. That doesn't always happen. The city is going to try our best to keep the sidewalks clear, so we're going to do our part and go ahead and pick that up. We did leave a little bit here in this case that wasn't containerized, and followed our procedures. But this is what we get a lot for $25. And then on the cleanup weeks as well, you can imagine this multiplied by many. Every house on the block could have something like this, but they often look like this, unfortunately. So, our proposal on my final slide here is to upgrade our cart fee to $75. It's currently $50, and the reason we want to do that is just to cover our costs. As costs of everything are increasing, our cost for buying the carts is increasing as well, so that's what that one is. And then we want to increase our bulk pickup fee to $50. We have the option of delivering 10 carts, and 10 carts are much quicker and easier to empty. And they can they can keep the carts and refill them as many times as they need to for another $50. And we propose $100 for the containerized pickup, which is like what you saw on the slide. So for $100, they can just put out whatever they need to be picked up, including bulky items. Another change would be the overflow bags are $5 per roll. That's a small change. They're currently $6. Again, prices fluctuate. We've got different manufacturer for the bags. Another highlight is that minor changes like schedule changes could be administratively approved by the Public Works Director instead of coming to you all for every single change. Anything that requires a fee change would still come before the Board of Commission, but a schedule change could be administratively approved. And then finally, the last item is to reduce those cleanup weeks. Prior to 2012, we actually had 2 cleanup weeks per year. And then currently we do one every other month, so we do 6. I think it would take a lot of strain off of our staff and our resources, obviously. But the citizens would still have the opportunity and the option to come to pay at any time. They could pay the bulk pickup fee and get their waste picked up. A couple of other options they have are the 4 vouchers per year. They can take unlimited loads of garbage to the Benson landfill and dump it for free. And they can do that 4 times a year. That's actually administered through the county, but it's open to all city residents as well. And then a couple times a year, the county puts out dumpsters. We don't really rely on that program, but that is an option that is available to us when they do it. So there are a few options that they would have even with this reduction in cleanup weeks. So that's a very brief summary of the ordinance changes, and I sent out to Laura, I don't know if she sent it to you yet, but okay, she did. So you've got a summary sheet of all the items. And if you have any questions, obviously, between now and the next meeting, we can get answers to whatever you need. I think that is pretty much it for the solid waste update. If you have any questions, I can attempt to answer them. And again, of course, between now and then is fine too.
Right. Not many questions, just I agree with definitely upping the fee there, because it was quite a bit in front of the home. There is one home in my neighborhood that has that, it seems, every week. I don't know where they get the stuff, but it looks like that every week, and I call and complain. I think that increasing that fee for that, because I would assume that you would send about 2 or 3 guys over and helping get all of that loaded into a truck or whatever that looks like. And to
Yeah.
me, that's, I mean,
It takes
I
a long
still think
time.
that 75 is still a good deal
Yeah.
for that. But I also think that if you show up to something like that and it is not appropriately, maybe there's like another fee that you add on that now we have to come back because you didn't do it appropriately or something of that nature. I also think that we also should look at the 2 cleanup weeks. Maybe it went from 6. Yes, we were at 2. We went to 6. Maybe we could go down to 3 and maybe do a spring, summer, and a fall. Sort of hit those points where people are cleaning out, spring cleaning, fall cleaning, and summer. Where it's warm, they can get into some of the bigger items or things of that nature. So I would maybe look at least 3 there.
Okay.
And then I guess my goal would be, you know, for some of the bigger items, I know that you get the 4 vouchers, but like for someone like me, I own a car, so I don't have a truck, I don't have a trailer or anything of that nature to actually use those vouchers. And it's probably really hard to find someone with a truck or trailer, so to use those vouchers. So for me, is there an option for a trailer that the city would have, that if I did have a truck that I could come and connect and do that? So I would just have to meet somewhere to get a trailer for someone to rent for a moment to take my trash there? Or has that ever been an option for people?
No, not currently.
Okay.
We could think about that.
I mean, it'd be better if someone just, rather than someone, I guess, having to pick it up, they could just pick up the trailer and load up their stuff and use the 4
Right.
vouchers. But that would be my concern that I would want, but I'll write down some notes and meet with you
Okay,
later.
sounds
So,
good.
Thank you.
Commissioner Rosen?
So I think to answer your question on that, I think Lowe's rents trucks on the hourly basis. I don't know if it's economically a good choice, but that is a way to use a truck briefly.
Yeah,
But
they do.
my question was actually, in the amount of stuff that you see out on the curb, like that example, are there things there that you think could have been useful to someone if they went to Goodwill or Salvation Army? Or do you think it's really all?
That's a good question. I think it varies, and it depends too on how long it's been out there, as if it's been rained on or anything like that. But
I was just thinking
It's
from the
possible.
standpoint, we could maybe have on our website to encourage people to place items rather than just trash everything.
yep.
Well, the Frank Waste app does give people ideas on, you know, if you
Okay.
have extra clothes or if you have a couch, if you. Some of that is already on that Frank
Yeah.
Waste app, so I do encourage people to download that.
Yeah.
I think one of the concerns we have with staff is the amount of time, because if there's particularly on a street and they don't want to block traffic, that this is why this is causing problems, because they're spending not just a few minutes picking up the trash and leaving, they're spending 30 minutes, and then that's more of a public safety. So I don't know if it's our role to kind of sort through and do that, because that would just take even
Well,
a lot
no,
more
I'm not
time.
asking us to sort through, but if we can encourage people to think of that as their first option
Yeah.
before just putting it all out there as trash.
That makes sense.
So not that we would take part directly, but that people would think of that, which is a good point, Lisa. you made.
Yeah, I think to that point, and in that example, that wasn't the tenant, was that was the landlord.
It was
probably.
probably the landlord after someone
and-
moved out. That's
Uh-huh.
typically what it
I just don't
is.
think they have the incentive to make 2 trips anywhere. They're just gonna put it out.
Well, increasing your fees then. I
Because
think
it
is our best
doesn't cost anything. So part of the changes we're gonna make is to identify who the responsible party is and to pay that fee.
Yeah, currently, we do have a process, and Byron could explain it better, but I believe if it's not meeting our regulations, then we will tag it, we'll notify them, and we'll leave it, and they'll have to bring it into compliance, meaning they'll have to put it all in garbage bags before we'll pick it up. And if that still doesn't happen, then we will pick it up and charge them an additional fee. Currently, that is in place. But with this new process, we just charge them a greater fee up front. Like that would cost them $100 up front. They'd have to call the office and schedule it. And if it did occur during one of our 2 or 3 cleanup weeks and it was free, the same thing would apply. It would just, we wouldn't charge them the $100.
Who are we charging?
The landlord, the property owner.
Property owner.
Yes, not the resident, but the
We're
owner.
not trying to track down, in that case, somebody who's moved elsewhere.
Right. Yeah.
But the landlord would probably just hold on to that fee and not give them back.
And some of them that we work with a lot, they are very compliant and they would follow. I mean, I don't think this would be a big hardship for them. I think it would be hard on some of our citizens,
Right.
but
Any other questions or discussion on that? I too, I think going from 6 to 2 seems like a big drop.
yeah.
3 or 4,
Okay.
I feel better about, but
Okay.
depending on what the financials look like. But I do agree though that if we have 4 free, we can go to the dump 4 times in a year. We need to encourage it.
Okay.
Thank you.
Thank you.
All right, I'll stay up here a little bit longer. So, my next update is on the Singing Bridge. This is just a real brief update. We became aware of a federal bridge investment program that would help us in saving and strengthening the Singing Bridge. So we met with the KYTC and talked to them about our idea of applying for this money. But before we do that, we need an engineering study and an environmental study. And so KYTC committed $300,000 towards this effort. We don't know if that will cover the entire study. We hope that it will. Currently, Chuck Knowles is drafting an RFQ for these engineering services. And so hopefully in the next few months, we'll have a better idea of the cost, because of course anything above the $300,000, we'd either have to go back to KYTC and ask them for more, or we'd have to cover that additional cost. But we hope to apply for that in the next year's cycle. Currently, KYTC is drafting an MOA to get this whole process started and get all the details worked out. So I know that's brief. I don't have a whole lot of information, but if you have questions, I will try to get the answers.
Is
Commissioner
the
Ross.
Capitol Avenue Bridge our bridge, or is that a state responsibility?
The Capitol Avenue Bridge is state.
Okay.
They actually are both state.
Oh,
But they want it to funnel through the city and kind of have our input on the process and kind of take the lead on the process.
okay.
But the Capitol Avenue Bridge is in obviously much better shape currently, so.
I think they did some work not too long ago, so I was just curious.
Yeah. So our idea is to strengthen or improve the current bridge, not to replace it, as far as the Singing Bridge.
Yes.
If I may add, one of the things that Katie is also taking the lead on is developing a short and long-term capital improvement plan and also asset management plan. So that is a way that the city can look, if we talk about sustainability, looking into the future and starting to plan out some major infrastructure investment that we'll need to do. So when we heard about these funds that, and we had to make sure that the state would be okay with us doing it, this is what we thought of first, since we know that the Singing Bridge condition is not as good as the Capitol Avenue Bridge, and it's important for our community historically, that wanted to apply for this will be able to apply next year, but also this would be starting that first steps where we will hopefully present to you later on, several months down the road. We've just started meetings so that we can engage you guys in the short and long-term capital improvements and looking long-term what kind of investments that we need to make sure that our assets and our infrastructure are well maintained.
Thank you on that. Yes.
Since we're on the Singing Bridge for an update, we just got an email saying that the Singing Bridge was going to be closed to vehicular traffic from 9 a.m. to 3 p.m. on Monday, September the 19th for a follow-up from the August 10th inspection. So, but the sidewalks will still be open for pedestrians to cross.
Very
And
good.
it just came through.
Good timing. Okay, and my last update, I guess at the end of August, I presented the Colin Jones MOA for your approval, and there were some questions raised. So I wanted to just update you on a little bit more of the details on that issue. So again, as a refresher, in the 1960s, the city entered into an agreement with Colin Jones Sr. to operate a landfill on his property. I think that is probably fairly unusual for today, and probably even then, to operate a landfill on private property. But it was only operational for about 4 years, so by the 70s it was closed. And from then on, the city has maintained a cap of soil over the waste. In 2013, the state Division for Solid Waste Management they paid for Kenvirons to conduct a survey. It's called a Stage 1 characterization. So it looks at environmental concerns as well as many other factors, and identifies what concerns there may be and how to proceed in the future on maintaining and operating this facility. The outcome of that study was that they had no environmental concerns, and their requirement was for us to keep the waste covered with no ruts or ponding areas. So the city continued to do that, and then shortly after they entered into this agreement with Colin Jones Jr. To do this at a monthly fee. He owns the property, he has soil there available to keep it covered, and he does that on a monthly basis. And he has been for at least I think it's about the last 5 years. The site is not currently regulated by the Kentucky Division of Water or Solid Waste Management. The reason for that, it's under kind of what we call a prescriptive management rather than a performance-based, meaning we don't have to do water sampling or do anything to verify that we're not polluting the environment. We just have to meet these certain requirements that their history and their data shows. If you do this, you will meet the water quality standards and environmental requirements. So in this case, that was just to keep the cap on the waste and keep the surface water draining off appropriately. Currently, we're paying $1,250 a month, which equals out to $15,000 a year. It's any other option, I think, is going to open the door for other environmental concerns, because we really don't know what waste is there, and it would be expensive to dig it up and do something else with it. So that's what kind of led us through this process to the proposal to continue this agreement with Colin Jones at $1,250 a month. And the one thing that we will add is our inspections, monthly inspections, to make sure that everything's looks like he's doing what he's supposed to do and he's meeting his side of the agreement, and that we're getting what we're paying for. So it's a long history. There's a lot more to it. I'm sure you have more questions. I'd like to bring this back to you at the voting meeting to approve. And so between now and then, if there's questions, if there's changes, if you want to do it a year at a time or something, or whatever you want to talk about between now and then, obviously we will do our best to get the answers. That's it.
Commissioner Unger.
I just want to say thank you for the information. I just want to make sure moving forward, if we vote on this contract, that if any issues arise, things don't immediately fall on us because he isn't maintaining. But it's all good info. I appreciate it. Thanks for letting us know.
Commissioner
Just
Rosen.
to clarify, it's like 16 acres. Is that the size?
That's right.
Okay.
Mm-hmm.
Am I hearing correctly then that because of the standards that we're required to meet, we don't have an understanding truly of if there are pollutants being introduced or if there is contamination to?
No, we don't know what materials exactly are there, and if you dug them up, I think we may have an issue. What we do know is in 2013, there was no pollutants of concern found. And so while we don't think that anything, it's all contained, in other words, it's underground. They tested the groundwater as well as the surface runoff and didn't find any issues at that time. And so as we continue to keep it covered and make sure that the surface runoff goes where it's supposed to go rather than soaking down through and possibly picking up something in the waste and taking it out into the environment, then No, we don't 100% know that we're not putting anything out there, but the common practice and data shows that if you do this, it's probably meeting the threshold of environmental pollutants that are allowed.
Commissioner? I'm sorry, Commissioner.
Sorry. Did we look into brownfields and brownfield money and landfills?
Yes, I think that they are two separate issues.
Okay.
A landfill could not be
Okay.
eligible for a brownfield
Thank you.
if all the waste was taken somewhere else and then left, then maybe, but not the landfill itself.
Commissioner Waters?
So with the information that you've brought us, I'm assuming that this is going to be something that we continue to do from here on out till someone else becomes new ownership, or does it become new ownership and we do continue this? You had made the statement that we're not sure what is underneath. If we did dig it up, then it would be some concern. So since we don't know exactly what's underneath, we can't really foresee giving a good time span of when everything is deteriorated under for us to go back to not paying, or is this something we're just going to have to pay, or is it something we can just take over the property versus paying $12.50 a month? Is it something that we can just obtain and let that be us? I don't know the options of what this is, or how long it takes to deteriorate to say, hey, this is not a landfill anymore. And if we don't know what substance is under, it's hard to say whether it's plastic or paper or.
Right. Yeah, I think that is the hard part of this whole thing, is that the agreement says in perpetuity, and I don't know the answer either. I don't know if that stuff will deteriorate, decompose
Right.
in the next 200 years. I'm not sure I can answer that, but I do know that just looking at some of the studies that they had done before they did look at digging it up and pulling out recyclables and disposing of waste somewhere else. And it was like $1 million project. And they said, well, we can just continue maintaining this for 65 years at that cost. So, I mean, I don't know what the finish line is, but at this point in time, I would say yes, we're just going to continue to have to maintain it. And it might be an option for us to buy the property and operate that and do it ourselves, but not that I don't know that he'd want to sell it. He does use the property for other things as well, for farming in other areas. But yeah, it's a weird situation that I don't unfortunately have all the answers.
In this contract, though, do we have first right of refusal to buy that land? Should he ever sell it?
I don't know that that's in there.
We should probably have that, shouldn't we? To make sure we control
We can
that
look into that, Laura.
before we commit to another $1,250 a month.
Yeah.
I
'Cause
think
if
we
we
need
do-
to have a backup.
Yes.
We need to control that land.
I just think we need the land. Because at $12.50 a month, 12 months, multiply that times, let's say 65. I mean, we're at $975,000, which is almost that $1 million of us going into cleaned up. And so, and does that get handed down to whoever, if he passes away, does it get handed down to the kids? And this is just something that continues in this.
Yeah,
That's
I know,
just questions
That's
that I
what has
have.
happened so far.
Yeah,
since
it just
the
continues.
60s.
Yeah, so it
Just
just
stays in
continued
the
down,
family.
and it stays in the family as, oh, this is like a free asset for us,
Yeah.
and I just don't want to be a family heir asset if we don't need to be, and I think
Okay.
there should be something there that maybe we can obtain that piece of property.
Okay, we'll look into that some more.
So that brings up a good question. Environmental Protection Agency, whether they would have any money for cleaning up something like this
Yeah.
that we could apply for?
Does the EPA have any?
Yeah, no, we could apply for this.
I would have to look into that too.
Well, that might be something worth looking at. Paying for $15,000 a year forever isn't that appealing. And also, what Kelly brought up too is that it could be leaking into groundwater and things, but it meets regulations, so we don't know.
Yeah, there
Lot of
are.
questions.
thresholds. I mean, it's not like you can't put a drop of a pollutant. And the idea is that it's meeting that requirement currently. But we want to be obviously good stewards of the environment.
Thank you.
Thank you.
Thanks, Katie.
Last staff report, I get to do and wanted to do a quick update on one-time improvement funds. As you all know, I've sent you all a memo. We've had a couple of discussions in the last month or so about some one-time capital improvement funds that we can use after we passed the rainy day policy, and we set the limits for making sure we operate prudently with 3 months of operating cost. And what I would suggest and wanted to talk to you all about before, of course, bringing forth is the suggestion that we bring these projects in at 3 different voting sessions, September, December, and February. Some of these items are very timely, so we would like to probably vote on them sooner rather than later. Others may need some other factors from other departments or other decisions or other input from the Board of Commissioners on it. And so some of those I think could be spaced a little bit later. So for the discussion for the voting session on September 26th, what I grouped together is funding for the Simon House, who are here tonight to talk about some of their needs to be able to house people safely during the winter. Meals on Wheels, the Capital City Senior Center, hiring a contract HR recruiter to help with our recruitment efforts, town gown programming, and I put in there the Humane Society. Now, I want a note on the Humane Society is that it would be an advance. And last meeting, the Board of Commissioners instructed me to meet with the county and understand if they had plans or if they had met with the Humane Society about this effort. I did meet with the county. They have not yet decided whether or not they will support with cash or in-kind support for the road. The number I came up with was a $60,000 advance towards the $71,500 that the city normally pays to this Humane Society for animal control. And this was based on if the cost of the road is $350,000, and the Humane Society had said had their estimate of $180,000. So if you subtracted $180 from the $350, what Humane Society to be responsible for, and you subtracted the $50,000 that the Frankfort Plant Board has committed towards the road, what you would be left with is $120,000. So I did say to the county, if we could split that, it would be $60,000 each to help fund this project. And again, that this would be advance on the money we normally pay for the animal control. I present this to you all as so you can discuss, review, or change for in advance of the September 26th voting meeting when we bring this forward.
Commissioner Rosen.
I actually have 2 things there. First, NREL is working on our plan for meeting the resolution for 100% renewable energy. And I believe that we'll be doing a report on that in October, and feel that we should move that one, which is scheduled, I believe now for February, up to possibly September, but definitely December, worst case, because we want to keep moving on that. There's evidence of effects of global warming in areas like California, which has had extremely hot temperatures just last week, and I think we want to keep moving on that. And second, on the Humane Society, I know it's on our schedule to discuss in the September 26th meeting, and I like the possibility of giving the Humane Society the $300,000 with the understanding that if they came into a lot of money and had a large sum in their unrestricted fund, that they would reimburse us. And I think that they've had some unforeseen expenses in building their new building, and that this would help them to meet their goals, and it would help us to know that animals are being well taken care of. So I would like to see voting and discussion in the September meeting, and tending that direction rather than taking away from money that we're already giving them for services that they offer for us or take care of for us.
I do not wish for that on the next. If anything, that we could possibly do as we discussed in our meeting that we had on Friday, and maybe doing an advance for that for $60,000, and that's a lot right now for me to even fathom right now, given the situation. But more than $60,000, I myself cannot say that I want to discuss that in September. I will not go a penny more than $60,000 as an advance, and we also need to make sure that we are aware that we are not a bank, and we're not here to make advances just for anyone. The reason why that the city has done past advancements was because of emergencies and regarding to our homeless people and our homeless situation during COVID and things of that nature. That is an emergency. That is something that needs to be done on behalf of our community and for our community. And so we need to understand and make sure that it is written somewhere that we are not just giving advances just to be giving advances. We are not City Hall Bank. We're here to help subsidize organizations, and that's what we're here to do. And right now, as we're leading up to November, we're leading up to December, which is cold months, and we are to think about the Simon House. We are to think about the Sunshine Center. We are to think about the women's shelter and the men's shelter. So we do not have people on our streets during these cold weathers, and that's where our money needs to be thinking of as of right now. So that's how I feel. I'm not sure if others feel the same, but I will not think about giving more than $60,000.
I can also follow up from our discussions to see the will of the board. That's what I would propose, and then can follow up with you all as well.
And we're going to talk about the Humane Society on the September 26th meeting as we
Yeah.
agreed last time.
Yes.
So we can flesh that out, but I'd consider an advance and other, I'm waiting for other creative proposals as well.
Yeah.
I don't think what Commissioner Rosen's point though, 300,000, that's as if the city is going to fund the entire road. And I don't think I'd be willing to do that, the entire road.
Well, the idea was that once they have plenty of discretionary funds, that they would pay us back.
But there's no guarantee they'll have plenty of discretionary funds that we'll ever get that back. And you're suggesting $450,000 in the first phase here, and that's we can discuss that at the next meeting. But I would like to see there's the strategic communications director or position support in the December. I think we need to move that forward to the first. I think that's of critical importance today. We need to do a better job of telling our story. We hear it from our community partners that we don't do a good enough job of tooting our own horn. I think we need to take back control of the messaging that comes out of City Hall, and this is something I think we need to do right away. So I think I'd move that forward. Yeah, Commissioner Rose?
And Mayor, that was that $50,000, I believe. My computer had a glitch, I didn't bring it up. So I would be okay with moving that position up. I know that I spoke with City Manager in regards to the position that is out there right now, which is the
Contract recruiter.
The contract recruiter. I think it started off as contract diversity. Now it's contract recruiter. So I'm not sure if we know what we really want in that position. And I don't think a lot of people have applied for this position. And I think if we're going to think this, we should think through of what we exactly want, and that would be $50,000. And I said that we shouldn't just hire to be hiring. I believe up on leadership with Alexis, one of our new employees here, working well with fire department and police. She's gone to a couple of recruitment activities here in Frankfort and in Lexington, that maybe that's something that she can sort of pick up and help us with right now and moving forward, and then we can round back around to that position that is there. So I would be okay with moving that particular position up in that manner of switching those two things out. And then we can rethink about the recruiter position. But I will add on to what you were saying, Mayor, in regards to financing for the Humane Society is that as a financial advisor, as you know, when you're building a $4.5 or $4.7 million building, you should definitely have at least 20% on the side for increasing in building and things of that nature. And right now, we're really underneath, $350,000 is underneath of that for that 10 to 20% threshold. So poor planning, maybe. Some more discussion in the buildings of where they can save. But I have appreciated in speaking with the new president as well in this in detail. So I think that there may be some other things coming through the pipeline by that September. But I look forward to the September 26th for us to make our final decision and for that to be off so we can concentrate on other things in our community.
We'll discuss all of these, right? Will we vote on this? Is that what you foresee, voting on the one-time improvement fees at the September 26th meeting?
Right, in the groups of 3. I can suggest the rearrangements and reach back out, and then if you all agree to that, then there would be the group for September, a group for December, and then a group in February.
Any other discussion? Anybody else?
I agree with some of the talking points that we've heard tonight. So absolutely, the communication support, I think that's vital. It is part of economic development as well. It ties into, we're at this, really great crossroads right now in our community where so much is not being highlighted, and we need to really focus on what we're doing well and what we're doing right, and having somebody in that seat to tell that story, I think, is crucial. I also agree with Commissioner Rosen and talking about with National Renewable Energy Lab at this point, get an update in October. It would make sense to try to know that we're going to be committing funds by the end of the year, so that December, I would be in support of that as well. And I know we're going to be hearing from Simon House, so and I know we have more opportunity to discuss. But those are the 2 things that I absolutely agree with that I've heard.
Any other discussion or questions?
Where's your baby, Lisa?
You know,
Commissioner Green?
I hate to even say it, but to me, I would like to see this stuff done this year.
All of it. All of it.
I would like us to be able to discuss them all
Yeah.
by the end of the year. And I know that puts a lot on staff, but I feel like we've talked about enough of these that I think we can do the work that we need to do to discuss it before the end of the year.
I think that's,
And I know that is, I'm asking for a lot. But if we could just look at February and move a couple of those up, that sounds easy enough, right?
Just two phases.
Yeah,
let's try to do things.
Yes.
Okay.
well, it is kind of
something.
I
a,
know
Consider.
everybody's rolling their eyes right now,
Consider.
but.
well, it is a package,
Yeah.
that works together to some extent, so that makes sense.
At least have it moving in the right direction and implement and ready to implement if it needs to go into this.
Right.
We want it all and right now.
Yes.
We got that.
May I?
Yes.
May I interject on that one?
Are you going to do
Yes,
it sooner?
please.
No, it's not. I can name that. Yeah, I want it done by November. No, I would like staff's opinion on what of these would require the least amount of time. So if we're looking at the human resource time investment, what the low-hanging fruit projects are. So maybe that goal isn't so gargantuan when we look right at there and just say, okay, well, this
Right.
is a simple run it down roll call. It's yes or no, and So I'm open to that as we move forward to next meeting.
Right. Sort of like the tennis courts, I believe, that are on there. I think that was about 70,000 or 190.
190,000.
And if we're going to do that, we don't want to wait, like sort of Commissioner Unger said, until the spring to start talking about that. If we want to look at it, then to go ahead and allow Sean to start doing that, where we can get an RFP or any of that out, so they can maybe start building first thing and not doing the 6 months follow-up and stuff. So I would
Yeah.
agree.
Okay.
Good discussion. Thank you, Laura. City Manager.
Discussion items?
Now, moving on to discussion items now. Mission Clinic is number 1. And I'll let you take it.
Thanks. We have Reverend Michelle Carroll here, and happy to welcome her. who's going to present about the work of the Mission Clinic, and who in the past have received subsidies from the city. The Mission Frankfort Clinic provides free basic medical, dental, and pharmaceutical care to the uninsured in Franklin County. Thank you so much, Reverend, for coming in to speak with us this evening.
Thank you. Thank you for helping us out for many years. I have with me Dr. Kim Bell. She's our medical director and president of the board. And also Dana Nichols, who is the vice president of our board. You already said we provide medical, dental, and pharmacy services to people without insurance. Almost all of that service is completely free all the time. In very rare situations, we get into you need a prescription that we don't have and it's $10. And if you really can't do that, we'll get that too. So everything is completely free for them. We see a lot of patients right now who are Spanish speaking as their primary language. It's been an interesting change through COVID from with the dynamics and the demographics of that. All of our healthcare providers are volunteers. We typically have 4 or 5 doctors or other providers, 2 dentists, about 3 nurses or a phlebotomist, and other people as well who are there helping run the clinic. The part that I am always so grateful and makes me want to be a patient at the clinic, for anything we have to do where we're referring them out or getting them into medications that we as the clinic can't afford to buy, which is usually insulin. We manage the entire paperwork, bureaucratic healthcare system process for all of our patients. Many of them are going to come in with, they don't get paid, and they get paid in cash. So they don't have the right stuff to turn into these forms. But we know how to do that and help them manage that, and are able to work together with that. We have about 4 clinics per month. 4 of those are medical. Then we also have 2 additional ones that are dental. And at all of them we have pharmacy services available, which is a very big draw for our patients. We have started seeing patients from surrounding counties that have free clinics because they do not provide free prescriptions. That was one of the big philosophies when we started medical almost 20 years ago. What's the point in seeing a doctor if you can't do what they tell you to do, So we're very glad that we provide that service for them as well. I will let Dr. Bell or Dana say a little bit too.
You go first, or you want to?
Okay. So we just appreciate your support in the past, and we hope for your support as well in the future. We just, and really part of our vision and our mission is to be able to provide services to all of those. And so we know that we're only probably hitting, we guess, probably 15 to 20% of the eligible patients for our clinic. And some of that is just a provider basis. So the other thing I ask for is ask your provider, say, hey, have you heard of the Mission Clinic, and are you willing to volunteer? Because that's really how we can get patients in the door. Referrals a lot at this time are just word of mouth. A lot come from Frankfort Regional, but really primarily word of mouth, and so we haven't formally advertised as far as our services. So that's an opportunity also for us to be able to expand our services from that standpoint. We have been in service for about 20 years, so I'm just going to invite you. The 27th of September is our 20th anniversary. It's on a Tuesday evening, and if you've never been to the clinic, I really invite you to come. You can come any Wednesday night. We can contact Michelle, or Deborah is our clinic administrator, so any of those. I'll turn it over to Dana.
Thank you. So I've been involved with the clinic for a few years. I served as the part-time clinic manager for 3 years, and then that was I started around 6 years ago. Then took a different position, but was thankful to still be involved. I was invited to be on the board and serve as the vice president. But I'm very passionate about the clinic, happy to answer any questions at any time about the clinic. Dr. Bell has donated thousands of hours of her time at the clinic and served many, many people. It's a very high-touch environment. We take care of people. A lot of folks, even who maybe have Medicaid but don't understand how their benefits work, we're happy to help them, connect them to services or providers. A lot of folks who we help you know, of course, are at the homeless shelters and that type of thing. So we're serving the same people, and our neighbors and here in the community. I mean, I live like 2 blocks from here myself. So, you know, we're happy to be able to do that. But, you know, also we serve a lot of folks who work in restaurants and put roofs on houses. And, you know, a lot of folks have jobs and just don't have access to the health care that they need.
Actually, I would probably say the majority of our patients are working.
Yes.
There's
Not that
a-
it matters,
a
but-
rare person that really, sometimes we get in that gap between we're working, but you know, or we're not able to work and we're not old enough to get Medicare and we're not yet eligible for disability. So
Yeah, and a lot of people kind of in that in between where maybe they had Medicaid and now they don't because their income has fluctuated. And, you know, we just take care of people. We help them with their diabetes, with their high blood pressure. We keep them out of the hospital, keep people healthy. So we appreciate your support. We hope you'll come visit us. And we also do, so we are located within First Baptist Church downtown, but we are our own nonprofit organization, 501c3, have a board of directors, of course, and that's how Dr. Bell and I are involved, along with others in our community. But yeah, and the church, though, does donate a lot of in-kind things for us, our rent, our utilities, Michelle's salary as our executive director. But we do have students involved as both paid interns as well as people in programs come and learn from our amazing professionals. So it's a good place. Hope you'll come visit.
Any questions?
Yes. Of your different clients, how many do you think are homeless or homelessness is a part of their health problems?
Not that many.
Okay.
Not, most of them have somewhere to live and are working poor. We do occasionally see someone who's homeless. I would think that typically if they're in that situation, they've gone through a program where they would get them signed up for Medicaid or Medicare. And so we don't have, if they come to us, we would send them to somebody else who's going to do that for them as well.
Yeah, when I worked there, it was typically a handful of people, you know, small percentage. But if anyone did come from the homeless shelter, though, certainly we help them.
We would see them, but we'd probably get them into a different, you know, to Medicaid so we can serve more people that don't qualify for that.
Thank you.
Commissioner May.
I just want to say thank you for being in our community, and thank you, First Baptist Church?
On St. Clair.
Yeah, on St. Clair. Thank you to them for offering a spot for you to work out of, and I wish your services weren't needed, you know, but it's so thankful that you are there doing the work that you are. And it looks like hypertension is the highest thing that you're treating, and I would imagine that a lot of hypertension is probably brought up when you don't know how you're going to pay to take care of yourself, your kids,
I
your
will
spouse.
say, I mean, Dr. Bell is, you know, helps people get treatment for cancer when they didn't know what was wrong with them, or people who had heart attacks. And there are some really high need individuals who were able to get over to UK or some other, you know, facility that has also programs to help.
But our bread and butter is high blood pressure, heart disease.
diabetes, heart
Diabetes.
disease.
Kentucky.
Yep. And I can't remember if it was Dr. Bell that said this, but all of our providers really love coming to the clinic. And they have told me over and over again, I don't have quotas. I don't have stuff that I have to do at my job because they told me to. I can spend, if we need to spend 45 minutes in the room, that's fine. We'll be here later, but we will get it done. So I'm just always grateful for the quality of care that all of our volunteers provide to everyone.
I have one follow-up as far as the program's concerned about perhaps outreach, and you may already do this. Do you work with local businesses to let employers know that this is a service available where they could have flyers as part of, or information?
We have not done that yet, but that is an excellent idea, and I'm going to probably do that
We're going
tomorrow.
through our strategic planning process now, so
Yeah.
add that to the list.
We have very good word of mouth within the Hispanic community in the area. Have a wonderful part-time Spanish language administrator who helps us. So we get a lot of self-referrals through that.
That's a great idea though for our strategic plan, because we have a lot of housekeeping from, you know, hotels and the hospitality industry and the restaurants, lots of restaurant workers. So that's a great idea.
So right now, you don't have any capacity issues. You could serve
So
more.
with dental, we do. We have some issues with dental.
We have very bad dental volunteer problem. If everyone in this room, please, would ask their dentist when you go see them to please come to the clinic. But that is not an us only problem. The entire dental industry is.
We also have issues with our dental equipment, so we're working on all of that, to get an upgrade.
But we can typically see a new patient for a medical appointment within 2 or 3 weeks, depending on their schedule. We have one that's on Saturday, the rest are on Wednesday night, so sometimes that's an issue for patients, but we typically get medical patients in pretty quickly.
I just wondering, so you estimate you're only taking care of about 15% of the eligible population.
Probably.
So how do we get that? One of our strategic plan focus areas is accessibility. How do we help you get the word out and get more people served in our community, which helps everything?
Oh, yes. I think that would want to include a lot more money, but would also include a lot more volunteers. I think if we're going to expand to that capacity, which is something that we've talked about doing, it would require bringing in full-time healthcare positions who are able to see people during the day, as well as volunteers who come in at other times to do that. We had one opportunity and looked at potentially moving into a building elsewhere in the community that was not inside the church, because just the space that's available would eventually limit our capacity there. Even there's room we can move into at the church, but not probably as much as we would want to serve everyone. So we're continuing to explore that and see when that makes sense for us, and just work on building up to all these things so that we can serve our community better.
Keep us posted.
Thank you so much.
Commissioner May?
Dental, yes. Do you all ever work with like UK's dental program and
We do.
students?
We've really attempted to do that and incorporate student learners into our clinic as far as dental students. It's a little bit, right now the way the rotation works is really they need to have intensive time for 3 to 4 weeks in one site. And where we're just once a week, it really doesn't give them an opportunity to do their rotations, the way they are required to in order to get their dental experience. So it's a gap that we haven't been able to cross, but we've actually been trying to kind of cross that gap for several years, but we just, because of the way the rotation requirements are, the clinic, so it truly has to be people that are interested in, I'm coming to volunteer my time and I'm not getting any credit as a student.
Okay.
We do have quite a few pre-dental students who come and use their hours to build up before they go to dental school. And we have a partnership for pharmacy students with UK and with Sullivan University, and they come regularly and really get to do a lot of hands-on work. We're small enough that they can do a whole lot when they get there compared to somewhere else. But we know driving over from Lexington often is not as attractive to all of the students as it is to just go in Lexington somewhere.
Well, that was going to be my question with Kentucky State with our nursing program. That do some of the nursing programs come down? Students come down to do a few hours in regards, because it's not just dental, but other things with Kentucky State.
Occasionally, we have continually tried with Kentucky State to get more of that going, and it just never seems to take off for long enough to get it going really well.
We have had some paid interns from K-State over the years. Not necessarily, when I was there, we did not have any from nursing, but from other programs. But yeah, I mean, we're always.
Yeah, we do have paid interns from Kentucky State, Georgetown, and UK regularly who come in during the week for several hours and help with the running of the clinic and are paid.
Well, I just want to say thank you for your services and all that you do, because just alone getting people to understand or getting people signed up for Medicaid is a huge thing, because even those of us that have health insurance, it's very intimidating when you see those health insurance, and what you're signing up for. So just having that information. And I'll say that when I was a college student coming out of college, I did not have insurance at the time because I was transitioning over to work and in between, and your services actually helped me with a cracked tooth. I was in so much pain. I could not afford it as a college student coming out of Kentucky State, and you guys took care of me down at the church, and it was simply amazing. And I remember Dr. Birch being there, so she was just so wonderful, and
we're glad we could help.
Yes, so I appreciate you. I knew you're there, and I've actually sent some people your way that I knew was in some of that, hard times of not being able to afford it. So appreciate you, and hopefully that we can stay in touch and see how we can help out and get more people your way.
Thank you so much.
Thank you.
I just had one last, it's more of a comment, but On your statistic of about 9,792 people have unstable insurance in Franklin County, and Franklin County is about 50,000, so it means approximately 20% of the people in Franklin County have insurance, health insurance problems.
Yes, and so unstable, which I got those figures from the Foundation for Healthy Kentucky. Unstable is you did not have insurance at some point in a 12-month period. So they might be insured for most of that, but if they didn't have it for a couple months while they moved jobs, that would. So that's probably why that number is so much higher, I think.
Well, it's still pretty high. It's 1 in 5 people in the county have some kind of insurance problem through the year.
Also, sometimes people will obtain it coverage either through health insurance or Medicaid, but it may take them some time to get in to see their provider. So we help them, until they can get in.
Sure.
And a lot of people are underinsured, and we really struggled, should we include underinsured in our service population? Because maybe they have insurance, but they have a $2,000 deductible. And if I have a $2,000 out-of-pocket expense, how am I going to meet that? So, in addition to uninsured, I think there's underinsured. So, thank you.
One more quick question, sorry. What talk about advertising and more than word of mouth. Do you have annual fundraisers or events that you guys do that you want to bring?
We have surprisingly never done that, and I have no idea how the clinic has made it 20 years without that. There is a graph on your handout of sort of where our funding comes from, and right now we are leaning too hard into one grant that we get every year, so I'm actively working on diversifying all of that and getting us going with some more traditional nonprofit fundraising from individuals, which you can also all join us on Tuesday, September 27th at 7 o'clock for an open house. That is our 20th anniversary, the day. And I found the picture of the first 4 people that we helped. So if you are able to join us, we would love to see them.
Will do.
Exciting.
Thank you. Next up for a discussion item, we're happy to welcome from the Simon House, John Martin, who is the board chair, our own Shelley Hearn, our community policing advocate, and Janet Gates of the Franklin County Women and Family Shelter. I also, I don't see Tommy Haynes here. I know he was invited. The Board of Commissioners instructed staff to reach out to the Simon House to have them present on their needs to enable them to welcome those needing shelter overnight, especially before winter. And also I spoke to the county fiscal court, and the same individuals will be speaking to fiscal court on September 23rd about their support needs. So we're happy to welcome you here, John.
Thank you, and thank you for inviting us. The first thing I want to do is thank Michelle for everything you do over there, because we refer folks to you, we've met before.
Yep.
And this is part of the partnership we need to see in this community to deal with those who are so challenged. And I graduated you from K-State.
You did.
And I'm proud of you. And to respond to a couple of your questions, we work with K-State in several programs at Simon House. We're working with the nursing program. We have interns, and I'll be meeting with the Dean of Agriculture and all that area to look at some cooperative programs.
Awesome.
I don't know what materials you have this evening. I know letters have been written in support of what we're doing.
John, I've sent all those statements have been provided to the Board of Commissioners.
Great. Then let me just touch on a few things. We know that homelessness is an issue in this community. Very, very few people, if any, know how big an issue it is. I was asked by an administrator outside this group, well, where are they? I don't see them. Well, they're under the bridge. They're on the river. They're out behind the AOC, Administrative Office of the Courts. They're all around us. And we refer homeless to you, but thank you so much for keeping people from becoming homeless, because that's one of our programs too. We have 3 primary programs at Simon House. There are 3 legs on our stool. We have the one that everyone knows about on Campbell Street, the facility for women with children and women who are pregnant. That's been there since the 1980s. We also have a community programs, which is really, really critical for the community, because it helps those people who are on the cusp of homelessness so that they don't go there. And then we have the third one, which we have just started, and that's the shelter. We are currently staffing from 8:30 to 4:30 every day, 7 days a week, a walk-in shelter. And it's really been utilized this summer with the heat. We need to expand that to a 24-hour shelter. Initially, the 24-hour shelter was to have opened a year ago, July. The county and the city have worked with us on renovating the building and bringing it up to code. That didn't happen. COVID, a whole bunch of issues. The need is there. It's demonstrated. What Simon House needs is help to staff it. We cannot do this by ourselves, and even with our partners who are helping us, we can't do this alone. And paying for staff is the issue. And that's when we've met before. We've touched on this. So the shelter is the third leg of the stool that can help the community. And we know we have 16 beds currently when we're ready to open the 24-hour shelter, and that's a drop in the bucket with what we potentially need. We have very few barriers. Anybody can come into that shelter. They can come in drunk, they can come in high, they cannot use while they're on our property, but we're open to everybody. And our community programs dovetails with the shelter, and we do things that very few shelters anywhere do. We are not a warehouse for the homeless. We provide services for jobs. We help people get documents if they need them. We have counseling, and in the next week we're going to be hiring, we've already hired, well, a nurse will start to work with us. We're going to have a part-time nurse on staff. We are currently certified to do COVID and HIV testing, and we can also administer Narcan. So we are very comprehensive. What we need is help to staff the 24-hour shelter. I don't know what else to say. I have costed it out, some of us have talked about this, at $15 an hour or $20 an hour. What we're looking at, as you saw in some of the documentation from Mark, our executive director, who's out of town this week, 2 persons per shift, 24 hours a day, every day of the year. When I costed it out at $20 an hour, because we don't know what we're going to have to pay, we're aware of how impossible this situation is right now, it came out to about $1,000 a day for staffing. We are currently have 2 or 3 people on our own staff who are working down there, so the $1,000 a day is not what we're necessarily requesting, but that's where the goal is to staff it. And if that is funded, then that frees us up to do some of the other services better than we're doing. That's basically what I want to say. You mentioned fundraising. Our major fundraiser is coming up. I'll give the push October 14th at the Country Club, Margaritaville, and we can get you information about that. It's a pretty big deal, and we have a lot of fun. So I am more than happy to respond to questions or observations or suggestions.
I'll ask, so at $1,000 a day for employees, how many people can you shelter 24 hours with that?
We can shelter 16 hours in the sleeping shelter. You've seen it, so you know what it looks like. Currently, when we started the project, we were looking at other parts to do for the project. We don't have a laundry room. We don't have a fire suppression system. The fire suppression system, and I don't understand code at all, I don't know how anybody does, but apparently with code, with the fire suppression, we can double the in-house residency to 32, which is still inadequate. We have been very fortunate in being able to get equipment for that facility. We got a gift of hospital beds from the Fayette County Health Department. We've gotten mattresses. So it's been great. And people sleep in there during the day. It's amazing when I go into the shelter, occasionally 5 or 6 people will be zonked out down there.
Go ahead.
So my question, and I'm understanding that we're at 16, and then once the sprinkler system and all of that, we can try to double that to 32.
Right.
Which
That's my understanding. I'm not
That's
an
what I've
architect.
understood as well. And that still is not going to help. It's a drop in the bucket still, even at 32. It helps more, I would assume. And so your goal is that you're needing $1,000 a day for staffing,
And that's at $20 an hour, full staffing, yeah.
full staffing for those people. And then you're looking into, I guess what we've found that you may be trying to purchase the building, which I completely
another
don't
piece.
understand that. I just don't think that at this time that you should be purchasing your building. I think that it should just be given the circumstances. But I also, in that if you were to purchase that building, that puts you also in a rut, again, of how we come up with the money to purchase the building. So what are your thoughts on that?
I've got
And
thoughts.
before you say that you're going to spend 100 and whatever thousands of dollars, I'm sure, on this building, what does that look like? Is that a building that you want to put that kind of money into? Or is it suffice for us to look at another building?
Those are great questions.
And that's what I'm concerned with, and I'd
Okay.
like to hear what you have to say.
Let's start with the building purchase.
Sure.
I had an email today that the contract is finally ready to sign. It's been going around and around for about a year. The purchase price is $175,000. We negotiated that. We are currently paying $1,000 a year to lease the old health department building. The county has agreed to extend the purchase date 1 year, so November 2024 is when we will finalize the purchase or before. We have started discussing a capital campaign project to raise $175,000. Contacted several people to see if they'd like their name on it, things like that.
Okay.
Is the building adequate? When we first looked at it, we went, wow, because it was just really amazing. And in some ways, it's quite adequate. In other ways, it's not. One of the things that we have not talked about in terms of homelessness much in this community is we do not have a facility for homeless men with children. And that's critical, and that's growing. I see people nodding behind me, I think. I can't see them. And that's an issue. And when we open the 24-hour shelter, we're not going to be able to house children immediately. We do have it set up for both men and women. So that need exists. When we first looked at the building, we thought that we might be able to use half of the upstairs to set up a living area for single men with children, but that area is now being used administratively and for clothing and outreach and supplies, because we supply a lot of clothing and housewares to the community. So, no, it's not going to be adequate as we move forward. It's adequate where we are right now, and right now we haven't moved very far. Is that a fair statement?
Yes, so that makes it a little clearer, is that we're helping the situation. However, there's still going to be another situation that we're going to have to address moving forward, which is going to be another expense for another building or another location.
Right, or an expansion on that property.
Okay.
I don't know. One of the issues with that building, which we really haven't talked about much, is it does not have an elevator. So there is no way in terms of access to go from floor to floor. You have to walk around to get into the two levels to meet those requirements. I don't know if structurally it would allow a third floor with an elevator. I have no idea. But that's an option, or another building on that property if we choose to stay there. It's a good location. It's on the bus stop.
Yeah, it is.
And it's close to K-State. And about a little over a year ago, I met with Barb Hayes, who's the police chief at K-State, also a good friend, and we talked about K-State and Simon House partnering more, and the issue with homeless students. And we have had students referred to us.
Yeah.
I know when I worked at K-State, I was aware of students who were homeless living in their cars. So it's not, and these are people who may be from out of town, but they're Frankfort residents when they're attending school here.
Correct. So if we ever, in regards to the students portion, I know that some people here in communities enjoy having international students come in and stay.
Yes.
Is there any way that we could sort of have a program or something to where we know if something happens with a student and they become homeless,
Yes.
that there's families here that would like to take them in?
This gets into a legal area that I know very, very little about. There are some issues we've experienced in the past with a case where we had an international student who was receiving benefits, and we had to be careful in terms of funding sources.
Okay.
That's all I can say, because that's probably beyond my knowledge base there. But I know it does walk into some issues with funding. A couple people have raised the issue, and I'm glad you said what you did with the students, about us being a shelter for Franklin County and Frankfort. That's true, but homelessness does not stop at our border. We have helped people from outside the community. We had a case a couple months ago where the police department brought a person over. She was from Indiana, had met her dream boy on the internet and was moving down here. It didn't work out, and so she was brought to us about 6 o'clock in the morning. We helped her. We put her up. We got her services, and I hope she's back in Indiana and doesn't decide to date on the internet again.
Something I remember, John, is that I think out of the 484 out of 500 and some of the people you helped were all Franklin County residents.
Yes, the majority vast.
Yes.
It is vast.
And I think that's
occasionally-
really important to mention. It's our
It
community.
is. But homelessness is homelessness. We're not going to turn
Right.
somebody away because they don't have an address here. And speaking of address, that's another issue. That is of great concern is the follow-up with the homeless community because they are transient. We don't have an address. I've worked with KDPH in the HIV/AIDS program. I kind of coordinated the HIV epidemic statewide a couple years ago. And I kept talking about homelessness in terms of medical needs, follow-up. I'd love to do studies to see where these people end up. How has our help helped them? And you can't find them. They really, and you experienced some of this with your crew too.
We just have to hope they show back up to the clinic.
That's right.
So we
That's
know
right.
what happened.
And follow-up appointments when they have somebody contact them is a toughie. That's part of what we do. We try to stay in touch with them and bring them in.
So if you're extending the 1 year before you purchase the building, perhaps
Yes.
maybe you will do that. But
That we will be signing that contract. It'd be great if they give it to us. But by the same token, we still need the funding to operate the center, even if the building's given to us. That does not replace that funding need.
Correct.
But if you're not going to purchase it for a year, I think that one of the things we discussed, I think internally, was the paying for the sprinkling of the building.
That's correct.
But I don't know if we would do that.
That's an interesting discussion we need to have. And I've talked with some folks about the sprinkler system and the potential cost, and it's huge, and it's gone up. And we know that delivery times and costs have just gone through the roof over the past 2 years with COVID.
But at the very least, though, we could pay for staffing to get the 60
Yes.
people overnight.
Now, let me talk about that in a slightly different way. We are ready to open the 24-hour shelter through the end of the year once we can get the funding to hire the staff. Our executive director has assured me we can find the staff. Cold weather's coming. October 1st would be the last quarter, but I don't think we could open by then because your vote's coming up at the end of the month. But whatever we can do. But what we have to see is consistent, comprehensive funding starting January 1st. This can't be piecemeal that will open through the end of December. We need to have some sort of a commitment to keep this going. Homelessness is not going to go away. And honestly, even though the economy is improving, there are certain areas in the economy where I see the potential for an increased need. And I'd love for the two of you to say some stuff if you'd like to. I don't want to be the only show in town.
Well, I'm Janet Gates and Director of the Franklin County Women and Family Shelter Transitional Housing and Recovery Housing Programs now. Big name, we're in the process of changing. We're the ones who operated the emergency 24-hour emergency shelter for single women and families with children up until last July. We turned away some federal funding because we have always been a sober living environment and encouraged people to work on those issues. So that was a board decision, and that's when Simon House stepped up to take on this charge and operate a 24-hour emergency shelter, which we have not had in our communities because of lack of funding. We've had to turn people away. We have no place for single adult females to go that are homeless now. And every shelter in the surrounding counties, if you call them up, If you show up on their doorstep, they might be able to help you, but if you call them up and say, we have somebody, they're gonna say, we're full also. So this is a crisis. It's a crisis across the nation. It's a crisis for Franklin County and the city of Frankfort. And I'm here just representing our board to say that we do fully support funding for the Simon House to be able to operate and be staffed. We do qualify that in saying it has to be sustainable and there has to be a plan moving forward for accountability. We have proven that in our agency over the years, and we appreciate all the support that the city and the county have given us to help us do that. And Simon House has done that too until the recent years where there's just been one mishap after another that's happened with COVID and just the crisis getting greater and greater. So our citizens in Franklin County and those surroundings that come to us begging for help, sleeping on the streets, sleeping, couch hopping, whatever they are doing, they deserve our help. They deserve the city and county's assistance with this. So whatever you all can do to look at the budget, I realize I keep hearing there's shortfalls coming, there's shortfalls, but there is funding streams out there that we can all work together as a community and apply for. But right now, the funding's just not there for them to open the 24-hour shelter, and I think that's a shame. And we continue to receive calls, but we refer them to Simon House, but it's just they don't have the services except the daytime. So I'm just here supporting them and the effort because we are part of the continuum of care now, that next step when people are ready to say, okay, I've had enough. I'm ready to work on issues. I'm ready to move into an accountable program that can help me move beyond whether it's substance use or not. That's what we are now, and we served that purpose all along until last year when we did didn't give away anything, when we stopped providing the 24-hour service that Simon House took on the charge to try to meet, and the funding's just been lacking. So I hope that you all will consider that strongly, support their request, and support the other social services that are providing the agencies like Mission Clinic, like us, like those that are helping people move beyond homelessness when that's an issue, or helping them stay away from becoming homeless. So I appreciate you allowing us to speak tonight.
Just a couple things. Simon House doesn't have to be the agency that does this, but we do need to do the work. Simon House is stepping up to do it. So even if you don't work with us, we need to work with someone to take care of this problem. We really do.
Hi, I'm Shelley. I was hired to be your all's community policing advocate with the Frankfort Police Department. One of the concerns that our department has been seeing, obviously, is that we get repeated calls to ensure the safety and health and welfare of these individuals that we get called on. And our officers really aren't equipped to spend the time to find the underlying causes of homelessness. And so as I get called in the middle of the night, or if I get called on the weekends, or if I get called from one of our officers needing assistance to try to help one of our homeless individuals, I'm referring them to these agencies. And I'm also getting denied services from them because they don't have the funding to do it. God love Michelle. I call her so many times to help us at least try to get at least one night for somebody at a hotel. As far as the numbers that I've seen for myself, I've responded to at least 229 cases, and at least 74 of those cases were involving homelessness. That doesn't count all of the other responses that the officers have attended to without a social service response. So I want to make sure that you all know, is from our standpoint and from the department standpoint, we are addressing huge concerns of the homeless population, and we get calls constantly from our community wanting to address the problem, and there's just no solution right now that we have. So, thank you.
One of the important things that's happening, and Blair can talk about this probably better than any of us, is the CARES Coalition as we're starting to work together. One of my big goals is that there's been no competition at all across the agencies. We need to be working together and moving in a niche direction rather than competing. And that's starting to happen, and I'm really excited about that. Simon House has taken over the 24-hour hotline. We don't get a lot of calls. We do get calls, and when we get a call, it's usually an emergency. So I'm not probably telling you a lot that you don't already know, so there's no need for me to stand here for another hour. unless y'all have questions or observations for me or us.
I just would like to add, I appreciate all that you guys do, and I call on Shelley a lot when I get answers or questions coming in from the community. We were just working, like you said, with a single father that I think had 5 children, and it's, we don't have somewhere for him, and so we're working on that, and she was there able to navigate with you guys. But, I definitely support, this was definitely on one of my list of things that's important to me for a one-time, payment out of this monies that the city manager has brought forth. We can't so much, I guess for me, I can't call it that we are going to subsidize your employee, funding that would be funding to you, and you put where because, you are your own entity. But this is a Frankfort and a Franklin County issue. And I, add where the mayor was sort of going of us paying, we're looking into paying for the sprinklers, but, we see fit that if we're paying for sprinklers, that the county is selling property to you.
That they own,
that it's just, it's not baffling. It's not baffling to me. It's the county. And so for me, they do need to step up where it is needed. And they have to do more in this community. Where the community is needed. And we, the city, have to work with the county and vice versa, as you stated, CARES is. And we have to come together and they have to do their part. And I would hate to see that any magistrate right now, given the circumstances, would want to sign a sheet of paper of wanting to charge you $175,000 for a building that is needed right now when they can do a write-off and definitely give you that building. And then we can come in and help in the area that we were wanting to with the
I negotiated that amount down to 100%.
Oh, I'm sure you did. You have some hard people over there on that court, but needless to say, we have issues, and it's just not a city issue, it is a county issue. We are a small community, and we come together as one. And not only are you helping, but you're also giving them the resources to become able to be back up on their feet and be a part of this community, and that's what I appreciate.
And we have seen some incredible success stories. If I may read about 4 sentences.
Sure.
I asked one of our staff to give me a summary of some of the good things we've done, and I want to read this. Worked with a couple, BN and KA, to get them a place to live. Their house they were living in had been condemned and they needed a place to be, so we got them a voucher, and now they live in their own home apartment and are doing very well. And these are the folks who show up, and Blair has seen this, at our door bringing us donations. I want to say one thing about the funding, and I think you know this. One of the issues we have, and all agencies have this, with grant funding, there's very little money available or in a grant for personnel. It's for services, it's for stuff. And so that's, if we could find the grant to do this, we'd be on it in a heartbeat. But grant funding does not fund personnel that I'm aware of. You agree? Yes.
They'll give you money to do it, but no one to do it.
Just wrong. Just wrong. Yeah.
Any other discussion or questions?
I thank you for bringing the information that you did, and
Thank you.
we'll definitely keep you guys in consideration in what we move forward.
And I'll be glad to come
You
back.
guys are part of that, and hopefully by September 26th, we'll have an answer for you guys and be
Thank
able
you.
to assist in some way.
And I'm available at any time. You've got, I think, my email and cell phone number. Thank you, guys.
Thank
Thank
you.
you for being here.
Thank
Thank you,
you.
Shelley. Thank you, Jen.
Thank you.
Thank you.
And I just want to say that thank you for Kelly Dykus for coming. She's director of our Sunshine Center as well, which is also a part of that as well with our domestic violence. So thank you for being here.
Next up, and Blair is already here, and Courtney Fallis to welcome them to do a quick demo of our new C-Click Fix app. I just want to thank them for all their hard work. Blair and Courtney and Bobby and others and department heads have worked really hard to launch the C-Click Fix app.
Yay! Yay! Very exciting. So I just want to say, you guys have heard most of this, but just we're on the completion end, and very exciting launching our City of Frankfort app. It is called the City of Frankfort app. It's powered by C-Click Fix. But I think it's really important to bring that up because Courtney put together a really great interdepartmental city team across all of our departments that actually we started meeting probably like a year ago. To walk through this app, and think about what we wanted it to be. So yes, in this initial stage, we're using it as a way for citizens to more easily report on things to us. But you'll see when you get on that app, it actually already links you to a lot of other things we do within the city. So we wanted to start this out being comprehensive, that this is truly going to become the place where people can go, visitors, our residents, whomever, to keep track of what's happening in the city of Frankfort. It has its own branding that follows our Kentucky Distilled branding. And actually Jordan Miller on our staff designed this with input from our team. So it's really been a great across the board effort here. So as far as our branding goes, we launched this about a week and a half ago publicly, and we actually have a how-to video that is pinned on the top of our Facebook page that hopefully makes it really easy for anyone to get on and see how that works. We're going to kind of walk through some of that today, and then Courtney's going to show you guys the back end of that so everyone can kind of get an idea of how those go through for us. So again, it's going to be comprehensive, really cover everything. So when you go to the App Store or Google Play, you're going to look for the City of Frankfort app, find that F, and once you download it, this is your home screen that you're going to see, and you're going to hit that plus button right there in the middle. It's going to take you to this page, and so your first step in submitting a new request is to choose how you want to upload your photo. The great thing about this is, and something we want to highlight is, we still are allowing residents or anyone to report issues in the way that they always have. Call us here at City Hall, email someone, talk to a department head, talk to a commissioner, and that is still going to get back to us and be addressed. But this is just adding another way for people to report things. And the great thing is that first option right there is your camera. If you are out and about and you see something, take a picture right then and there. And so that way you don't forget and it can more quickly get to us.
And the name of the app is the City of Frankfort.
City of
That's what you need
Frankfort
to Google
app.
in the app.
Yes,
Is City
that
of
is-
Frankfort, and look for that F with the puzzle pieces behind it.
Absolutely.
Okay.
City of Frankfort. So next it'll upload your image. You're going to click that next button. And then you're going to enter your location. If you are actually out and have your location services turned on your phone, it's going to populate what that location is already for you. If it's a photo, that has that geotag location on it, it should pop it in. If not, you can type that in and locate exactly where that is. And then you get to pick. So this is something that's really nice about this feature is, sometimes when you're reporting something, if you call City Hall, you may have to try to figure out which department you need to be referred to. This right here is going to give you a whole list. So you'll see for this request, we're reporting a pothole. You can go through our planning department. You can go through signage. You can go through environmental concerns. You can request step-up patrol in your neighborhood from our police department. So it
One thing real quick.
really
With
is
the Step Up
comprehensive.
Patrol, we want everyone to know that if you want to remain anonymous on this app, you definitely
Great
can.
point.
If you're reporting something going on with your neighbor that you don't want your neighbor to see, that's totally fine. So I don't want anybody to be scared that their information is going to be public because they have the option to be anonymous.
It's a great point. So then you're going to go next on that. And then you can do a description. You don't have to do a description, but if it's something, this pothole is located exactly in this spot or on this corner or by this sidewalk, or, I'm requesting step-up patrol, and you want to say because I've noticed more cars speeding or running a certain stop sign or, something like that, you can do that. And then that's that feature Courtney was talking about. You can submit it anonymously, or you can submit it with your information so that the city can follow up with you, but it's not shared publicly at all. And then you will receive an email that will let you know once you do that. If you choose to enter in your information, it will send you an email just as a confirmation to make sure that we received that. So that is the fun kind of front end of it. And then Courtney's going to go and walk you through our web-based version and then how things kind of look on the back end for how it's addressed.
Did you have a question?
Yeah, I did try submitting something and I got so far and then it asked me for a password.
So it wants you to create an account.
Okay, well, standing out in the sun, that didn't happen, I guess.
Okay. Well, I'm going to do a request for you and we'll get to that portion
Okay,
where. Okay. All right, here we go. So not only can you just make the request on the app, you can also use this web portal as well if people are more familiar with their computer. So I just typed in C-Click Fix Frankfort. There's us. let's look at the request first. You can kind of see what people are reporting around us, people who, you can actually click on the map and see what's going on there.
Was that a real concern?
Yes,
Yeah.
that one is.
No, the
Yeah, we
other
did a
one.
number of test ones.
Yeah, a couple of them are tests.
Okay. The one before that, I was like, oh my goodness.
Oh,
Oh,
the
Rouse
multiple
Avenue is that
potholes.
bad.
Those were.
Oh,
our,
that was my test today.
We did that this afternoon.
Yeah, that one wasn't real. I got that off Google.
I was like, what?
I know, I was like,
If you don't go fix
I'd say
that,
Rouse Avenue is that bad. It's pretty bad.
yeah. Okay, okay.
But yeah, so you can like use the map, see what other people are reporting, and then if you want to create a request, you go to new request, and it's kind of the same thing how she just walked you through on the slides on the app. Well, let's choose an address. Let's just say 315 West 2nd Street. Take us right there. We're confirming our location. We'll just do other. You can choose to add an image or you don't have to. And I just want to say the ability for our staff to go ahead and see the picture of what's going on really helps us to know what resources to send out. Because I worked in dispatch before I came over to IT, and there would be some people that would call and report a tree that fell in the roadway. So here we are, sending the fire department with a chainsaw, when really it was like a twig. So pictures are awesome, and this is new technology that everybody, we're not wasting resources by sending out stuff we don't need, and also we know when we need bigger resources. And your description, we're just going to say this is a test. So you can this is maybe where you got stuck. So you could be a guest, but it does usually want you to create the account. That way you get that feedback. That way it knows an email to send you back, hey, we've received your request, we've closed your request. That way there's communication back and forth.
That it was saying I already had an account and what was the password, so I tried all the passwords I could think of and that didn't work, so.
I can work on it with you.
Okay.
So there is my request. We will go back to the presentation now.
And so from there, on the back end, this is what it looks like when it comes into our staff, the request. And so they see it in our departments who already utilize a work order system. It flows with that. And so they get all of the information that they need and start to process that to go out and fix it. And then this, I don't know, Courtney, if you want to talk about this, or the video is actually the next part.
Yeah. If you'll go back
Yeah.
one. So, like she was saying, this is what it looks like on the end, but see if it says Lucity succeeded. So we actually have a work order system already with the city. It's called Central Square now. So whenever these requests go in, it's going into a folder in Central Square that we can automatically create a work order system. So this is something that the street department, Public Works is familiar with seeing. So they're already getting their work orders. They can get to work that day with the request, and whenever they're adding comments on their end, it's automatically updating the user of the app.
So,
Yeah.
so when submitted,
Oh, sorry.
if I go back, I can see everyone's submission. If they are not anonymous, I can see.
Right.
I can see them all, regardless if they're anonymous or not. Like I can see if, oh, Kelly put the one on Collins Lane. I don't have to put it. He did it. So I
Right.
can see that. Like, okay, that's the same pothole. Now my question is, when I submit it, and let's say it was a pothole in Collins Lane, so it will go in the system, and so will it automatically go where everyone can see it, or will you have to approve for everyone to see it? And I only say that because there's going to be that one person who's going to take probably obscene photos or anything else and say that it's a pothole, and it's going to be a picture of, and I'm just saying, so to avoid that is, do these things get approved?
It
We
does
just
not
need to
have
be
to,
ahead of time.
at this time, no, it does not be
So
approved. It goes
so
public.
now it's up to whenever we see that to contact the city and say, hey, you're gonna have to take that down.
And we see on this
Okay.
back end what's coming in too. So, and it's like how
Okay.
we monitor our social media. We
Right.
oftentimes deal with things like that on our
Okay.
social media and the same kind of issues. And so we can keep a read on it. This is what Courtney sees, and any of our staff who has access to that work order system
So we will
sees.
apologize in advance for anything that is not
Yes.
conducive of the city and
And we
does not
hope everyone
represent the
will
city, and we
use
will
it
delete as soon as possible.
appropriately. Absolutely. And if you ever notice anything that you think shouldn't be there, please let us know.
Yes.
And we're
Yes.
happy to check it out. Absolutely.
This is just a video we did to show assigning someone to the work order. So like actually whenever a person is assigned, this is how easy it is. But you get an email saying, you know, it's in progress now. Whenever it's closed, you get a closed email with comments of how your problem was solved. I'll show you a screenshot.
And then if you are the person who submitted that request, this is what you're going to get back if you've chosen to report it with your information. And something that Courtney brought up to me that I think is really important, that bar right there, if you agree with this change. But if you go back out and it hasn't been adequately addressed, it gives you an avenue to follow up too. So that way, you know, we can make sure that we're taking care of everything. And it keeps track on that main screen of the app, so you know we can see. And this number is not how many requests have been submitted; it's how many have been resolved, which I think is a really cool counter. Helps keep everybody accountable.
Thank you, guys.
Any questions?
Yes.
Okay.
So on the main screen there, how many drop downs below that can we put on there? So as we adapt and
As many as we want.
right now, I see if you want to apply for a business license, it's really easy to do. You know, some of the things we hear about it, the workflow. This seems like a good starting point. So I think I think it's a really neat application, and we have the ability to put everything here.
Yes.
And it's one centralized place. So I like that. My only suggestion, this is mainly, I guess the back end part is, when you put a pothole that's, let's say, a state road, because most people in the public don't know what's a state road or what's not. They think they're all city roads, and rightfully so. But you know, I submitted one, and it was Ann Street, of course, and I live on it. It's a state road, and we got a notification that we need to contact the state. And you know, I get that, but you know, we are in the service business here as city government. Maybe we can take over that and just let people know, state road, we'll contact them, you know, on your behalf. But because once you put it back to somebody, and the likelihood of a lot of people making that extra step.
Right, they've already went this far.
It's hard sometimes.
Maybe they could do see-click fix.
Yeah.
The state version.
And I know why we wouldn't want to do it,
We'll help
and I
them.
get it, but you know, that's my only so
I
far.
can understand.
Yeah. No, that makes a lot of
Because
sense.
it's a pain going through that process as well.
Yes.
It also sends notices, so like if Second Street's gonna be closed or something like that, anybody who has an account, we can send out a notice and they'll get an email with information. So we kind of can do it as a news flash. This is what's going on if there was ever anything we needed to.
So far, so good.
Yeah.
I like it.
We're happy with it.
One other thing to point out, you see pay property tax, and maybe Alicia can give a little update, because that's one of the things that her team is working on, is to be able to pay online. Well, not yet, when you come up to talk about other stuff.
But I think that's a great point, and exactly what the mayor was saying, and that's why this committee internally decided to call it the City of Frankfort app, because we want it to become that one-stop shop, and it will. Courtney and I are also working on our website revamp, which we just got to preview for the first time on Friday, which is going to be amazing, and it's going to flow exactly with all of the tabs and things you can use on that website. So,
Great.
Thank you.
Thank
Good
you
work.
all.
Keep it up.
Next up, Kathy Fields has here to provide 2 updates for us. One on employee benefits, and to share some information on the ideas for the Board of Commissioners to discuss on paid family leave.
Hi, y'all. I just want to kind of give you a sneak peek about more discussion to come in October with our benefits, but our benefits with HR, one of our big cost items, and so there's a lot to talk about. But right now, what I want to tell you is this is fall. It's our season when we start launching into open enrollment. We start looking at what our costs are, and we've got some of those costs back already. So for some of what we call our ancillary products or lower cost products, like our life insurance, our dental, and vision, coincidentally, all 3 of those are looking at roughly 3% increases. It's not horrific. They're all pretty low-cost products, so I'm not super alarmed about that. But our medical is where the big dollars are at. And unfortunately, after really tremendous run of staying under budget and low cost. We switched to Anthem in, I believe, 2016. And Anthem offers such deep discounting on medical services that we really were kind of able to ride on those high medical service discounts to continually stay often several $100,000 below budget. So we had a handful of years where we were in great shape budgetarily. Last year was our first year that kind of changed for us, but only mildly so by about 50,000. So we're still doing pretty good. This last fiscal year, we were almost $400,000 over budget, and that's driven largely by our medical cost. Some of the things that impacted that were that we had an unusually high number of high claimants. We've got catastrophic coverage to give us some buffer on that, so the city's exposure is limited at $100,000 per high claimant. Nevertheless, when you've got a lot of high claimants, as we did, we had 8 this year. That's like double kind of standard. Sometimes we only have 1 or 2. 4 is not unusual, 8's a lot. So we are nearly $400,000 over on our medical cost budget, wrapping up the fiscal year that we finished. So where I want to go to with this is that our insurance brokers, Assured Partners, know that this is a year we've got to really work hard and aggressively at kind of getting us back to where we had been, where we're staying in budget and keeping our costs down. So even with the modest increases we're looking at on some of our ancillary products, we're looking to see if maybe we need to switch carriers and go to different dental providers, go to different life insurance providers, go to different vision providers. But the big one is, and this is sometimes a difficult thing that you don't routinely want to approach because you don't have disruption of services. Employees have set doctors that they're used to going to, and that's not something that you want to fiddle with lightly. Once employees are kind of set, if your program's trending well cost-wise, you want people to stay set. But because we haven't experienced a good budget year, it's time to really take a hard look where we're going to get quotes and we're going to look to see if there's some way we can kind of get us back with lowering our cost, and that might mean switching our benefit provider. Well, it's unlikely we will receive lower discounting from anyone than Anthem. Anthem can have a tendency to a little bit ratchet up their administrative cost and their catastrophic insurance cost. So we're pretty confident we can come in with better pricing there. We just have to see how that better pricing is going to compare with a little bit less rich medical cost discounting. So again, just to kind of summarize that, next month at the work session, we're going to have our insurance brokers coming back. We will have the quotes in place at that time. Anthem has not, well, we've got some of the quotes. Anthem is not comfortable. This is routine for them, but it's probably particularly they feel this way after the year that we've experienced. They are not comfortable even providing us a quote yet till they have a solid 9 months of claims experience to make a projection for next year off of. So that's just to kind of tell you where we're at right now. More information on that to come. I will say when we get to October and our brokers provide firm quotes on the products that we have, it would be fairly critical to go ahead and move forward because we've got to get employees into open enrollment and make their elections for the coming year so we can process that all through and get them set up for January. Any questions? It was much more exciting in prior years when we had these great runs with our budget. It was truly remarkable, but I guess all good things come to an end. So
in October, you're going to come to us with
yes. Right now,
potential.
I kind of wanted to just fill you in on where we're at and what's happening. We certainly don't have enough information on our big cost driver, which is our medical insurance, to share with you for any meaningful decision making.
So right now we're actively soliciting.
Yes, for all the
bids,
products.
Or did we do an RFP for our medical, or we're just looking at?
Our insurance broker, that's their job. So they are actually going out looking at gathering those quotes for our medical insurance and for all the other products. So this could potentially, 2023 could potentially be a year where we've got a lot of new vendors for the various life insurance, dental, vision, medical, for all of those things or some of those things. But we'll look at how the cost play out. We already know that there's probably some ability to move some of the other products, like the dental product, but we're kind of going to wait to see what happens with the big one, which is medical, in terms of, again, recommendations that are presented. But ultimately, we will share the quotes with the board so that the board can see where these prices ended up, and then going from there, we'll have to make decisions about what we want to offer for 2023 to our employees. And I guess I'll say too, in case the board is not aware, our medical insurance program is what's called a self-funded program. So what the city pays for is those discounted cost of medical services, and we pay for a professional claims administrator. That's Anthem for us right now, but there are many other agencies that will administer your claims per your plan design. And then our catastrophic stop-loss coverage. Those are kind of the three big things that our medical plan encompasses. Again, paying those discounted claims, so you're buying a network, and Anthem is providing that network of claims discounting. Then they're administering it. We pay for the administration, and then we pay for that catastrophic umbrella type coverage where we don't have exposure on paying claims beyond $100,000 per individual or per covered life. So also family members or children.
Yes, Commissioner Rosen.
Does the surge in costs for this past year reflect an aging workforce, or is it something more?
Does this, the surgeon. I thought you said surgeon. I had
no.
medical on my mind.
No, just the surge to 8 versus whatever.
No, I don't think that it is age related. And also, this is good news. The bulk of it does not appear that it is ongoing cost.
Okay.
That's what I was going to ask. Is this COVID related? Is this something that would stem from that maybe we could see a decrease, maybe going back more of your average of 4 versus 8? I know it's hard to get into because it's personal information and things of that nature, definitely, and HIPAA, but, from us looking at it, that is high for us to have 8 being that we have under 400 staff. That's, to me, is a big number for such an increase in working with benefits before. But in that, we want to look at what services we're offering our employees and making sure that they are the healthiest being that they could be, definitely in their work area. So for me, that's sort of going back to is that a COVID increase? Do we foresee that? Like you said, I appreciate you saying that you don't foresee that it's long term, so it hopefully will decrease on some of those cases. But it's hard because it increases for all, right? And so for those of us that are healthy, that maybe just go for a checkup, which we're blessed to do that. And so how can we make sure that we're providing all services, whether that's are making sure, trying to increase more people and working out more or things of that nature? How can we do?
First of all, COVID related, I would say no.
Okay.
I'm aware of, I can't speak in detail, but
Correct.
I'm aware of several of the situations that, in my mind, there's no tie to COVID on those. So I think that's a positive. I believe this is based on memory. I've been here for 9 years, and I think previously our highest was 6. So this, I haven't, if memory serves me correctly, I haven't experienced or seen the city experience a year like this. But then if you think about kind of probabilities or just the likelihood, like, of this happening again, that's a plus. It's not likely to happen again next year, and I know that that some of those cases, not all, but we always have some high claims. It's normal when you're running a plan with this many employees. That's why we have the coverage to make sure that people that have these situations are taken care of, just that we usually don't have that high in numbers. So, my crystal ball says that we would see that number go down based on, again, some that I know won't be continuing. Nevertheless, we do have that insurance through Anthem where they are shouldering the excess above 100,000. So that will not be lost on them.
Right.
And that's part of the reason that we probably will need to look at some other carriers that will give us friendlier quotes.
Okay. Thank you.
Yes.
One question. Have we looked at also the premiums that we employees, we pay? I don't know, has that been a factor in addressing cost?
It will be a topic that comes up, and I guess I can't speak with a lot for what our brokers recommend, but I know through the wage study we recently did and through information our brokers have shared that we trend extremely favorably on our price points. So there may be, they may say that it's something that we need to look at making some increases on. And we haven't for several years, but I'll also temper that with, that's a hard question for me, because to me, when we look at where our costs are, we've got to look at reducing them through our service providers way more than our employees, for a couple reasons. What we collect in premiums is so small compared, so it's not moving the needle that much. Even if we make that increase on employees, it's not going to move the needle that much. So if we go for the big money, the low-hanging fruit, it's not going to be our employees. The other is we are working to be wage competitive, and this, I feel, by making our benefits low cost is a very cost-effective way for the city to impact our employees' bottom line. And I'll say that in that we could give an employee $1 more an hour, but on that $1 more an hour, we're paying a Medicare match, we're paying a Social Security match, we're paying a KPPA match. So that dollar is actually costing us like $1.60 or something like that. With benefits, that's not the case. So in my mind, it's a very cost-effective way to keep employees' bottom line and their net pay high by, like you give them more on the top with their earnings, and then the city's paying on that too at a higher rate, and then say you take some back through the deduction of their benefit, but it's, in some ways it's, a lot of people are kind of losing. So our benefits are very favorably priced, and they've been the same for a long time. So it could be that a modest increase might be appropriate, but I think we really need to be mindful that we don't erode the gains that we've made. That's my opinion on the matter. So,
Thank you, Kathy.
I'm just staying so now.
Stay on for the next one.
Yeah, the next one is a paid parental leave policy that is one that we've worked with Commissioner Unger on. It's a policy that super important to Commissioner Unger, and I think one that many of us, as we've talked about, can agree with the importance of ensuring that our employees who are having children have time to be home with their children. I think that's the easy button part of this item. And the policy that has been drafted that you all have seen is, I think, about 2.5 pages long. So if you look at the policy in and of itself, it also looks pretty clear-cut. It's modeled after family medical leave, so it's very similar to existing federal law, although it is more modest in that the federal law applies to many health conditions, and this is narrowed in to apply to birth of children, adoption, placement of child in a home, those kind of things. And actually, after this policy, I think, was distributed, more recently, Commissioner Unger thought perhaps rather than 12 weeks, maybe 8 weeks might be a better number. I'll let you, if you want to speak to that. Mm-hmm. So that's kind of where the policy is at. But well, I think it's easy to look at the policy as it is, those 2.5 pages, and the intent of the policy, and wanting to be sure that children are able, or not children, that employees are able to be home with their children. Seems kind of like probably a no-brainer. But it gets very complicated, and I believe, when we start to look at how the policy weaves in with other existing policies, such as how much paid leave do we offer employees compared to other agencies? How do we handle our sick leave program compared to other agencies? There's currently a sick leave buyback program that is also being developed right now, that we'd want to be sure that these two programs actually would work effectively together if they both go through. And at this time, we haven't really given that consideration to how those two programs would fit. And well, one program is giving an additional 12 weeks or 8 weeks of time. The other program is actually financially rewarding employees and paying them for not using their time. And so that part we have to, I think, be sure that everybody is aware of how all of this works together. And the cost impact also, I know that the city manager has described to us that in coming years, we're going to have to kind of look at how we maintain a balanced budget. And so I think it's important that the board just kind of has an idea in terms of cost. So I pulled some numbers, and in the last 12 months, this is for sick leave pay only, we paid out $713,863 in sick leave for active employees. That does not include what we paid for comp leave, for holiday leave, or for vacation leave. That is only for employees using sick leave. Then in addition, we paid out another $504,000 in sick leave invoices to Kentucky Public Pension Authority. So when we look back in a 12-month period, with the existing sick leave that we offer, the city spent over $1.2 million, not including the other leaves that we offer. So that's where it kind of starts to get complicated, is when we tie all of those pieces together. And so one of the recommendations that was made to me, which I in turn will suggest to the board, is perhaps seeing if there's a couple board members that would like to form a smaller committee where we could meet even weekly if needed, so that we can kind of aggressively get after that, because I know that this has been setting, and we want to get it resolved and closed. But I also think we're probably not quite ready right now. So at that, I guess again, I'll say if there's a couple board members that would be interested in being a part of a committee to look at this policy and how it works with existing ordinance and other potential policies that are in the works, or if you have any questions, let me know.
I guess I have a couple, and I've tried to read over this, and just making sure, family leave, and it looks like it covers the adoption, it covers birth, and I guess for me, a couple of areas that I think should be part of family medical leave would be the leave of a woman having a stillborn child, making sure that she or he, the father, whoever's working with us, gets the ample time that they need in something like that, for that to be in. I also look at family leave as also giving time for people, as we know, we're an aging group, and so a lot of us are starting to take care of our parents. So that to me is a change in needing time to get them transitioned to their home, because now you're taking care of your parents. And so I don't want to just negate that family leave is just about having a child, a full-term child, or an adoption. But I think family leave we have to really encompass the whole family, and making sure, because I know there are people that are taking care of their loved ones, and that can be a hard transitioning your mother from Florida to Kentucky to take care of them, and being able to start now wrapping your arms around her or he, whoever you're taking care of, in the home. So what kind of leave do they get to embody of changing? I mean, basically your family leave is giving you time to transition into a new world and take on other things, which is that. And then also definitely the verbiage for, someone who loses their child or has a stillborn child, to still give them the ample time for healing and going through that transition with their significant other during that time as well.
And to echo what you're saying, I just heard the same sentiment today about elder care and expanding the benefit in terms of how other employees would be impacted. Now, things like that can already fall under family medical leave, and we've had that in place. I think that was back from the 80s, maybe. So that's been in place a long time, and of course the city abides by that. It's federal law. The difference is that this policy now is laying in the additional paid leave. And so with that, again, there are provisions for elder care and mental health issues, like when people are grieving and trying to move on after the loss of a child, those kind of things. So family medical leave still is in place for that. We've got that and have for many years.
Yes.
What I think the decision before us is how much additional paid leave we would want to provide, and then for what things we'd want to provide them for. We have batted around the idea of just totally following family medical leave and opening up for all of those things. But then, of course, from a cost perspective and attendance perspective, those are concerns as well, because some of the department heads do feel concerned about just keeping the operational wheels turning. One of the things I didn't share, I guess I should have said this, we tried as best we could to track the number of births that we've had in the last 12 months. And it's a little tricky because not everybody requests family medical leave and not everybody is on the city's insurance. So we could pinpoint definitely 15, but then in kind of talking through, we feel that number is low. So probably 20 births a year we feel like is pretty good likely number for how many employees would be having children in any given year. And then just to give you an idea of how many people would maybe be home with those children.
So you mentioned the $500,000 payment to the KPPA. Is that when people leave and we just roll over the accrued sick leave?
Yeah, that's right. So we do not pay out sick leave that is unused directly to the employee through direct deposit to their bank account. Rather, that is reported to Kentucky Public Pension Authority. Then Kentucky Public Pension Authority bills us for the cost of that sick leave, and they apply it as service credit.
To increase their pension?
Yes, that's correct.
And if we implement this policy, this ordinance, so will people use our, like on FMLA, they'll use our paid sick leave first and leave their benefits to accrue, and they'd be incentivized to do that and to increase their future pension?
Probably. And so that's some of the reason that it's a complicated proposal. Again, it seems pretty simple, but when you start to look at some of these things, I would agree with what you're saying.
Questions? Discussion? So on the recommendations, we talk about the cost is at least $150,000 per year, but that's based on a 12-week.
Well, and I think that was based on guessing 10 people at the time, which I now think probably was a pretty low guess.
Okay, so but that was on a 12-week paid leave and not the 8-week.
Yes,
okay.
Yes, I do. Yes,
so
that's
that number
correct.
was high if you're basing it on.
Yeah, I think that
12
was
versus 8.
based on 10 people at $15,000, including like the matching fringe cost. Which now I would say, I kind of looked at that more recently, and I feel like 15,000 would probably be more like maybe 16.5. It's probably a little bit low, but that was not based on the 8. That was based on 12. So maybe, I don't know, 16,500 times perhaps 20 people times 8 weeks, or no, excuse me, not 16,500. Whatever that divides out to be. Then times 8 weeks, right? Yeah, I don't have my phone to do the math.
That's something that hopefully we can work out if we set up a group to discuss it. And you mentioned...
He was right. What he was saying was
Yeah.
right. I was saying it wrong. Yeah.
And I think I agree. I think I'm okay with setting up a small group with those that continue to work through this. I just don't think I'm comfortable in putting this on in the end of September for a vote at this time. But I think it is a great opportunity for those people to get on a committee to sort of talk down on this, because this does involve a lot of numbers and a lot of things that we have to take into consideration and make sure that we do get right if this is something we're going to implement and push forward, to make sure that the city's able to take care of that particular number, of whatever that number ends up being when we push forward. So I'm okay with allowing a committee to get together and still discuss the details. I'm sure Lisa would love to start that. Commissioner,
Would you like me to follow up to see who is interested tomorrow?
Sure.
Yes. And another question. So is there, do any other communities, if we do this, is there a way to put a lifetime cap on it? And, that way it's not something that I can't imagine somebody would do this, but I guess it's feasible that somebody could, every year they're off 2 months or 8 weeks for some family situation. Birth 1 year, taking care of a family member the next year, adoption the 3rd year, and maybe another birth.
It's our policy, so we have a lot of latitude with crafting it in a way that best meets our needs. I don't think that we, of course, would always need to meet family medical leave requirements. So if somebody did have 10 children in 10 years, every 12 months they are going to qualify for another 12 weeks per family medical leave. But that doesn't mean that the city necessarily would have to issue another 12 weeks of pay. So we could design that in a way that the city sees. So there could be a lifetime cap.
It's unlikely, but
Yeah, but if the city wished to do that, they could cap it.
it's good stuff. I
Thanks.
think we're good. Thank you, Kathy.
Thanks, Kathy.
Laura?
Oh, I was just, I was going to ask, so we're going to.
I'm going to follow up with them tomorrow to see who's interested in serving on the committee.
Okay, one thing I would suggest to you all just regarding that is whether or not we need a committee or whether or not it's a couple of people just working as they do, to keep up with.
Working group.
Rather than a former municipal one.
Rather than meeting and having a committee. So we might look into some options where sometimes we need committees like with the finance committee, and this might just be a simpler option. So
Thanks, Laura.
Our finance director, Alicia Boyd, is here to present on the draft investment policy for the city. I really want to thank Alicia for all her work and diligence in working on this for, I think you've been wanting to do this for a number of years.
So before I begin, I just want to ask for my grandma leave. Is that all right? 2 of them. No, I'm just joking.
This
Laura's gonna
also,
say no.
yeah. This is one of the things why it's important as part of our financial sustainability activities under our strategic plan that we've identified in doing this policy and the rainy day fund policy.
Yeah, so this is one of the policies that I would have liked to have done sooner, but other things get in the way, and I am very happy to have this under our belt mostly. I'm hoping that you will put it on the agenda for September 26th and vote to adopt this policy. This is part of the hard work of our finance committee, as Laura mentioned. We're rolling right along with a lot of these important things that we've wanted to do. The rainy day fund balance, minimum fund balance, and this as well. And trying to condense some of our accounts down, that type of thing. So hopefully you've recognized this. I definitely have, the importance of the finance committee. I do appreciate being able to come together and talk about those things. It's helpful for me to talk them through with other folks too. So this is one of those things too. So okay, so the importance of the new policy, the draft policy. Our current policy we're following right now was adopted in 1994. I was fresh out of college, and 1 year into my stint as part of the state auditor's office. So, and clearly you can tell I've been out of college a while now. So, we definitely want to improve upon our policy to adopt the new policy, because right now under our current policy, we can only invest in interest-bearing checking accounts, certificates of deposit, and then obligations of the United States and its agencies and instrumentalities. So the KRS that actually drives this is KRS 66480, and in the packet you'll get on the 26th, you will get a copy of that KRS. It allows for more types of investments, and among those would be mutual and exchange traded funds, individual equity securities, corporate bonds, S&P 500, the mayor likes to throw that term around a lot, S&P 500. Now, obviously, that's not all inclusive, but those are the ones that when I think of investments, I'll think of those types. And in your policy, that is actually in section 8.1, so I'll try to tell you where all these are located as we go through them. Okay, what does this policy apply to and what are the objectives? Well, the policy can apply to all of our cash and investments across all of our funds, not just the general fund. It's the sewer department, it's our restricted funds, it's all of our funds, not just one. So we got to think of it in terms of all of our various accounts. And that's actually no change from the 1994 policy. That's basically the same wording. And then another thing that I feel is very important are these objectives, and that's no change from the 1994 policy either. So safety of principal. One of our objectives is going to be principal stays intact. So we invest, we'll try our best to keep the principal intact if nothing else. Liquidity of the asset, meaning that if we need to get money out, we'll be able to do that fairly quickly. So we'll keep the assets as liquid as we can to meet our anticipated operating requirements. And then, of course, return on investment. We want to try to, maximize return on investment of all the city's various investments, accounts, that type of thing. So those are the three primary objectives for this particular policy. And that's actually located in section 3 of the policy that you got the draft copy of. So that's section 3. Okay, roles and responsibilities. I actually felt like this was a very important section. It's actually found in 2 different sections. It's in section 4 and also in section 5.3 of the policy. So we all have a role in this and we all have responsibilities in this. Now, the BOC's role is you've got your fiduciary responsibilities. You were elected by the citizens of Frankfort, and it's your fiduciary responsibility to act in the best interest of the citizens of Frankfort. And you're doing that, in my opinion, by adopting this policy to allow for us to, for lack of a better word, do a little bit more robust investment and try to, get the best return we can on our investments. What you're doing as the board through this policy is you're allowing the finance committee to manage the program. Now, managing the program can, it can mean any number of things. It can be managing CDs and checking accounts we have right now, by saying finance director or finance staff, through the finance committee. As I gave you guys that list, we're trying to condense and we're trying to do some things of that nature. And obviously, alternatively, we can get an external investment manager. And we actually do have a couple of those already. We have an investment manager with Community Trust, and we also have an investment manager at West Banco. So the finance committee is fully aware of all those things. And those were accounts that were set up prior to me getting here. And then what I will then do is keep all those records, and of course those transactions have to be recorded in the accounting ledger. But currently the policy now, the 1994 policy, states that the management of the investment policy will fall to the finance director. Well, that's a lot easier when we're only talking about interest-bearing checking accounts and CDs. But now that we're able to do a lot more with our investments, the committee makes more sense. And as commissioners roll on and off the committee, the goal would be to have those commissioners who possibly have a financial type background to help with that. So that's why I thought this was a very important new piece to add to the updated policy. And my apologies for not telling you this. This particular policy is basically from the sample policy that the Kentucky League of Cities provided everyone. Now, we tweaked it some for City of Frankfort, but it is in essence a policy that was the sample policy from the Kentucky League of Cities. So Does anybody have any questions about that? I felt that was kind of an important, thing to point out, what everybody's roles and responsibilities are. And of course, as you'll recall, the BOC appoints the Finance Committee members as well. So you still have that active role in, overseeing this from a fiduciary point of view, fiduciary standpoint. Okay, so how will we as the Finance Committee behave? Well, that prudent person standard means that we're going to act the way we would if it was our own money and our own investments. So I don't know about you guys, but for me I'm probably too conservative because, as my husband will tell you, I like to seed money in the bank. I don't like to spend money, and all those directors in there will tell you that same thing too. Maintain proper ethics. Obviously, we want to avoid conflicts of interest. As the Finance Committee, who's overseeing the investment program, we will report to you any financial interest, and I know I do that once a year anyways. I know Shermay sends me the financial disclosure that I have to do, and I assume that you guys all have to do as well. So we're going to refrain from any conflicts of interest, meaning we're not going to be doing business with the people that we're getting to do business with the city, things of that nature. And I feel that's quite important. And those two sections can be found in 5.1 and 5.2. Now, almost finished. So we have currently a list of all of the banks that we do business with, and I've provided that to you guys. And I will maintain that. I do maintain that. And so in Section 6, basically all this is under Section 6 of your policy. It talks about the depositories, brokers, dealers, that type of thing. So I'll maintain the list, and then of course the Finance Committee can ask for it at any given time whenever they want. And then also, as part of this policy, we're going to do periodic reviews anyways. So they'll be seeing this periodically. And then the Finance Committee will determine, and I guess in my mind I'm thinking we already know who we're doing business with, so if we wanted to go do business with somebody new, the Finance Committee would discuss that and bring the recommendation to the board. So, and that's one of the things I'll tell you toward the end. So, we'll get together and talk about those things. Well, what might make sense for an investment, things of that nature. So then, of course, nothing would happen, though, until it gets brought to the board for approval. To start investing in something obviously differently or new from what we're doing now. And then in order for a depository or a broker dealer to do business with the city, they have to meet certain eligibility requirements, and those are outlined in I think section 6.1, 1 through 5. It states some things that they have to be, one of 5 things. And then there's certain documents we would want to see. We'd want to see audited financial statements, their registration, that type of thing. And all of that's also in that section 6 too. So we're not just going to go out and just go, oh yeah, let's just go do this and, invest in this. We've got criteria, the Finance Committee does, on what we want to see from these folks before we do business with those, and before we get the city to do business with those. So in section 11 of the policy, this was another important part I wanted to bring up to you. You will receive quarterly updates, and I thought it made sense to say it would be in the month following the quarterly Finance Committee meeting, because I feel like if the committee's meeting, we'll meet and we can discuss the investments and how they've done, and then after that we will bring those quarterly reports to you. Now, we may not necessarily do the quarterly reports obviously ourselves. If we've got external advisors, they could do those reports on our behalf. So you will get your regularly scheduled quarterly updates, and also we'll give them to the external auditor.
And then at the end of the year, my guess is even though the policy says 40 days after fiscal year end, it might make more sense to do this in conjunction with the annual audit. And the reason why I say that is that sometimes we might make some audit adjustments here and there that would need to be made to the accounting ledger. So if you're getting audited numbers, those are numbers you're going to rely upon because the external auditor looked at them, and I would think it'd make more sense. And me personally, I would want to see audited investment numbers as well, so we could do that annual report in conjunction with the audit being presented, and that's usually in December. So, does anybody have any questions? I know it's a lot. So there will be no amendments made to the policy, obviously, once it's adopted by the board, until it comes to the board. It would ultimately rest with you guys on making any updates to it and approving those updates. Now, the finance committee would be the ones recommending, because we'll meet and say, oh, this isn't working, let's take this to them and get them to approve the update. So that's all in section 12.2. So nothing would happen as far as the new policy goes without bringing it to the board. And then the last thing, this is an example and one that the finance committee has actually already talked about. Now, the very first thing we have to do is approve the investment policy, but this would be what we would probably bring to you as a recommendation. I wanted to get it on your radar. So, we just approved the minimum fund balance policy, and it's currently at $12 million. Well, if we're going to try really hard not to touch that $12 million, we thought it would be a good idea to take 10% of that $12 million, which is $1.2 million, and invest it in some way, shape, or form. Well, Kentucky League of Cities has a good investment program that I should have asked. My apologies for not. I can get that information later. That a lot of cities utilize, and I do have a handout about it. And the very top thing they have on their highlights page of this is it conforms to, well, at the time, House Bill 69, but that became 66-480, Kentucky Revised Statute 66-480. So they've already got a program established that we know will comply with the statute. Lots of other cities are already using them. And so I feel like that would be a good place to at least start if we wanted to do that. And it would be some of our general fund dollars, obviously, but like I said, the goal is to not touch the rainy day money. So we put $1.2 million into the program, and we, see how it goes, and hope that market rate of return will be a good rate for us. So I really feel like that program would be a good thing to do, and I know that, like I said, the finance committee's talked about it. So what happens is, like I said, we'd have to adopt the investment policy first, and then through resolution, and I sent that to Laura Ross earlier, we have to adopt a resolution that basically says we will be part of this interlocal agreement to be part of this program. That comes a little bit later, but obviously not much later, so we'll focus on adopting the new investment policy first, and then we could then entertain that idea of joining the program and then investing the money that we feel comfortable investing. So that's basically all I have. Is there any questions on anything? Yes, ma'am.
I thought it overall looked very good.
Thank you.
Why only invest 10% in this special fund?
I think it was from, we were looking at it, I've got actually 3 of my finance committee members here. I think it was a matter of we don't want to, it's
conservative.
Right.
I feel
thought
like it was
allowed by law,
conservative,
you're
so.
allowed to invest 20%, and we thought we'd be conservative and starting out with 10% to see how it would go.
Yeah, you're limited to say what you could invest in an S&P 500 index. So we didn't want to. For me, I mean, I'm looking for the word here, but all I can say is conservative. Would like to stay a little conservative and then go from there.
Okay.
So, and it is brand new to the city. I mean, so it would be brand new to us, these types of investments. So it would probably be a good idea to start out conservative. So, yeah. Any other questions? Yes, ma'am.
Do we, I forgot to ask before, do we know the rate of return so far on the KLC program?
They sent us
Well, if you use, one of their funds is the S&P 500 index, so it just depends on how far back you want to look.
I didn't know how far long
Year
ago
to
that
date.
they started this program, so I just wondered.
Right, but the one fund though is, it tracks the S&P 500 index, and that's been around since the 50s. So it's, depending on how, now, the year to date, if you looked at it, it probably doesn't look too great. But over the last 10 years, it's substantially higher than what we'd get in the, that's the thing, the money that we put into this, I know we would look at the quarterly reporting on it, but that 10% that we would put into anything like this, we'd want to know that that's money that's for the long term.
Right.
That's setting up some future commission to have a larger rainy day fund in the future. And if we look at it, month to month or quarter to quarter, statistically it's going to go up most years, but there's going to be a few years, 3 out of 10, it's going to go down.
Right.
But on average, if we can get 10% as opposed to 2%.
Yeah, I mean, we're getting especially like on our interest, just straight checking accounts, it's next to nothing.
Right.
We get a little bit better on our money market accounts we have with some of the local banks, and then obviously CDs will do a little better, and savings account does a little better, but for the most part, it's nowhere near what you might be able to recognize or realize in your rate of return with one of these types. They actually have 1, 2, 5. They've got a money market fund, government bond fund, corporate bond fund, S&P 500 equity index fund, and a dividend focused equity fund. Now, I have no idea exactly what all that means. I'm learning about the different types of investments here, and then also, as the mayor said, it can fluctuate. It fluctuates daily basically. So that's the other reason why I feel like doing something like only 10% of the rainy day fund would be a good start. And then also, as the mayor pointed out too, if our rainy day fund is $12 million now, and we put $1.2 million into an investment, and it grows to $2 million, let's say, that's $800,000 that we don't have to grab cash from someplace else to keep our rainy day fund at the level we want to keep it at. And that's the long haul. That's the money that, as we said, we don't want to touch it unless we absolutely have to. So it from a just practical standpoint, it makes sense to look at it in those terms of using the rainy day fund that way.
Thank you.
You're welcome. Thank you.
Sorry, one other quick question.
Yes.
I know we talked before, but the money that we have in various accounts, you presented to the Finance Committee, and we're consolidating because we have numerous accounts and could consolidate them some. But you were also looking into seeing what newer or better rates we could get, and that would have an impact just on checking or CDs or money market accounts. That's going to improve right now compared to what we had before.
Correct. We did that. I reached out to our 4 primary banks and asked them to give us their best quotes, for lack of a better word. And they did, and which, of course, I think just in general, correct me if I'm wrong, Commissioner Unger, Mayor Wilkerson, rates are probably going up a little bit anyways, just, obviously. But they did all come back and give us some rates. Now, some of the banks, we only have just checking accounts with those folks, but a couple of the banks, we have more than just checking accounts, and we'll have, CD here and, things of that nature. So, but yes, we did reach out, and they came back with some, I guess, decent rates for us. So, yeah.
Better than they have been.
Well, I think it's good to ask.
Yeah.
That's good.
Well,
Or
and
they can just say no.
on the amount of money we keep in checking and money market accounts, it adds up. It's a lot.
Yeah, it's quite a bit. I was kind of shocked at how much we had spread across
Spread
a
out.
bunch of places. So yeah,
We need to tighten it up and
That was the
get
conversation we
higher.
had when you first came in.
yeah, yeah.
Lower
absolutely.
all these,
Yep.
put them in different accounts. Don't have them in spread out. It was too much.
So I'm respectfully asking that you put this on the agenda for the 26th, of which I will not be here, but my deputy director will be. And hopefully you'll vote to pass this, and then we can, from that point then, start getting with hopefully KLC if that's something we decide to do, and get the ball rolling on that. Because there's a series of things we have to do for KLC if we decided to go that route. So, yeah.
And first step is to adopt this new investment policy
Correct.
statement.
Correct. And the resolution that Ms. Ross has a sample copy of. So hopefully that was helpful to you. So
Thanks, Alicia.
Thank you.
Very good.
I'm just going to stand up here because I think whatever's next is also me
Hey, we're
too.
moving on to action items.
Yep.
Number 7, first reading, looking for a sponsor.
Happy to sponsor.
Sponsored by Commissioner May.
An ordinance fixing the rate of taxation for the year 2023 on all motor vehicles and levying said tax for all city purposes. This ordinance fixes the rate of taxation for the year 2023 at the sum of 22 7/10 cents on each $100 valuation on all motor vehicles subject to taxation in the city.
Any discussion on this first reading? Okay, and we'll move on to the next.
Sponsor.
Yeah, looking for a sponsor. And Commissioner Unger sponsors this one.
An ordinance fixing the rate of taxation for the year 2022 on all taxable capital of domestic life insurance companies subject to the tax and levying said tax for all city purposes. This ordinance establishes the 2022 City of Frankfort ad valorem tax rate at 5 3/10 cents on each $100 valuation on taxable capital of domestic life insurance companies.
Any discussion on this first reading? Commissioner Rosen?
I was talking to someone who said a few years ago the city commission did something for insurance companies and the number of employees. Does anyone know what that might have been?
I'm sorry. I couldn't. I'm sorry, Marta.
A few years ago that the city did something for insurance companies and their number of employees, and it was some type of tax thing that we did for them. I'm not sure the details.
I don't recall that because for this particular tax, we only have one company in the city. So if it was multiple insurance companies, I don't think it would have had anything to do with this. So,
Okay.
yeah. But if you can get me potentially some more information, be happy to try to look into it for you and research it for you. But no, ma'am, to my
Thank you,
knowledge, I
will.
don't have any.
It
I
was
don't know
just
of anything.
a casual comment. I'll have to dig a little bit further, but thank you, and I will.
Okay.
And moving on to another first reading, looking for a sponsor.
I will.
Commissioner Rosen.
An ordinance fixing the rate of taxation for the year 2022 on all real and tangible personal property subject to tax, public service companies, and levying said tax for all city purposes. This ordinance establishes the 2022 City of Frankfort ad valorem tax rate at 19 3/10 cents on each $100 valuation of all real and personal property, 19 3/10 cents on each $100 valuation on public utilities and public service companies taxable on a franchise basis.
Any discussion? Yes,
Sponsor.
Oh, we got Commissioner Rosen's sponsor.
I did.
Do you mind if I go on the record here? So that rate of 19.3 is actually lower than last year's of 19.6. And that's because assessments throughout the city's two districts have actually gone up. That doesn't necessarily mean somebody's individual assessment's gone up, but probably through buying and selling for the most part. And that's also, goes along with what I've seen with the other districts in the county. The county, their rate went down slightly, even though assessments went up. And also county schools. So I kind of try to watch that to see if I'm seeing what I've calculated for us, and that does represent the 4% revenue increase, even though it's a lower rate. And I've already got everything going for the public notice to go in the State Journal, and then on September 26th, obviously, for your public hearing and getting the second reading. So, but I did want to make that clarification for anybody that happens to be watching. It's a lower rate, which is a good thing. So, and that's what we're seeing with the other taxing districts too. Thank you.
Thank you. And that ends the action items. We'll move on to a discussion of a tentative agenda, investment policy statement. One-time improvement fees, Cullen Jones contract, a couple of first readings, waste management, and gosh, I can't read my handwriting sometimes. And a couple of second readings, as we know.
Oh, okay, and I do have one thing on the second reading. I guess I'm not sure if that's unfinished business or if it should be right now. It's on the Home Street, the change of zoning.
Oh, yeah, it's on the agenda for next time.
Right, but I just wanted to make a couple comments on that.
So can we do that right now? Oh, sure.
Okay. Yep, so I went there and I looked at Home Street. It's 211, 213, and 215. And it's all one plot of land. And it's right in between two buildings that don't seem to be used. Napa Auto Parts, I think it was, and a reddish building that seems to be empty. And it's right across the street from housing, from homes and an apartment building that seems to be not in use. But looking at it in view of our hope plans to do things with Home Street, this is 3 blocks from the transportation building, that intersection, and it's maybe something that I would recommend other commissioners just go and look at it and see what you think. So there's Barrett Street that's perpendicular to Home Street, and then there's Warsaw, which is parallel to Home Street. And what's on Warsaw are 2 state buildings, one with cars, their fleet plan, and another building that's just storage. But, and I understand that Joe Johnson, I believe, owns the property and wants to do mini storage on it.
Are we getting into a discussion here on this, or?
I think it's appropriate in either place.
Okay.
I'm just sorry, but not to cut you, but this is.
Sure, but I mean.
It's on the agenda for
taking a look
next.
at- Right, but, I mean, next time we would be voting on it, and this time is to talk about it, to say, think about it, maybe go look at the area. Is there something better we'd like to see the land go for? And I'm not sure about the definition of CG to CI and how that really affects how it's used. But it is pretty close to the downtown area that we're trying to do positive things with, and just, I'd encourage people to go and look at it and think about it. And if we need more storage, those 2 buildings that are there, couldn't they be converted into storage, and this land could be used for something else? So just to think about it, and that we'll be voting in 2 weeks.
Anything else on the upcoming agenda that we miss? We're going to do a paid leave committee, so maybe not.
Working group.
Working group, right, sorry, working group.
I think that's it.
Okay. And any, well, we talked a little unfinished business. Any other unfinished business?
I wanted to ask about the Capital City Museum and the potential rental we were going to discuss last month.
Oh, that's right.
I don't know what's going on with that, but I didn't know if that was still something.
So renting part of the State Journal building for storing.
Artifacts
Where's
that
the-
can be tempered.
I think, well, we have an update on that. There was no
Yeah.
business license, or there was no.
Right. As of Friday, when I talked to Ellie, the business registration was current with the Secretary of State. However, there is still a missing document for a city business license. I'm sorry I didn't have a chance to check in with Ellie today, but I know that she's going to see and checking in with David Jones to see if all the documents are filed and appropriate, as well as looking at alternatives, just in case.
Thank you. I will say on my part that the space that you guys would be using that's, you know, earmarked for that has been cleaned out. So it's cleared out and ready to go. So when all of the paperwork and everything goes through, everything's okayed, it can be like, you know, instant move in. As soon as they're got stuff packed up, they can move it in.
Well, for future reference, if we ever enter into a lease arrangement or any contract with anyone, do they have to have a business license?
Yes.
Everyone has to have a
Yes,
business license
that
if you're doing
is-
business, right? So
That is correct, Mayor.
that
Every
form
every lease, every contract, every bid, everything requires that they have all, not just business licenses, but all of their fees are up to date with the city.
But you can now get on the City of Frankfort app. Any other unfinished business?
I just had
Discussion
one,
on that?
I would just like to see if we could have staff continue the conversation with Yes Arts. I've been over there several times and discussing things with them. They're sort of outgrowing that space down at the bottom, and they're looking to maybe see if there's a possible way to use some of the upstairs storage, see if they could rent that for some storage, because they are running out of space, which is a good thing because they're offering more events and they have so many kids that are enjoying themselves there and being creative there. So I'd like to see and how we can add part of upstairs onto their leasement, at least for storage or something of that nature, or maybe for them to, I think they were looking to grow Yes Arts as far as maybe bringing in a counselor that I think studied maybe the arts of counseling or something like that, and maybe that person could have their office upstairs for more private sessions or things of that nature. So if maybe staff could open up that conversation with them just to add that on versus increasing the rent, you know, just giving them a little bit more space for right now.
Any other new business?
Well, unfinished business, there's one thing, we were gonna have the boat tour, which I was gonna miss, but the boat tour got set aside because of the river rising and, but to look at that spot that's a sand beach below the dam and to see about getting the boat tour going again.
We'll reschedule. Yes.
Any other?
Oh, is this new?
New business.
Okay, making sure. So we're moving right along. I wanted to bring something just as new business to the board. I'm on KBC Leo, and I sit there, and they're bringing up in Louisville, they're wanting to apply for a stamp in the honor of Muhammad Ali. And so they have sent over their resolution for us to take a look at. And so I could sort of read over that a bit, but it sort of states, this is basically trying to get a stamp through the United States Post Office in honor of him. I think even though we're in Frankfort, they're going to try to get all cities and things of that nature in Kentucky to support, because he is a Kentucky hero. He's have so much, honored here and just all that he's done here in not just Louisville, but in Kentucky and in the world. And so I would like for our city to be on board and helping write a resolution in support of this, and then moving on to where other organizations in Frankfort could also support as well to get that stamp. And I'll share what they have sort of put forth, and then I'll also share this with staff, so we don't have to start from the ground up. We can start with something. And it says, whereas the United States Postal Service honors extraordinary individuals who have contributed to American society, history, and culture and environment, whereas the stamp program was created to commemorate positive contributions of American life, history, and culture, whereas Muhammad Ali, Louisville's native son, clearly had contributed to American society, history, and culture as a singular and renowned figure in the transcending sports, civil rights, peace, activism, freedom of thought and faith, global influence, and humanitarianism. Whereas as an athlete, affectionately named as the Louisville Lip, was the 1960 Olympic light heavyweight boxing gold medalist, 3-time heavyweight champion of the world, and Sports Illustrated Athlete 20th Century. Whereas as a humanitarian, Ali fought against injustices for many disadvantaged groups for all backgrounds. Whereas a world figure, Ali utilized the fame and influence to promote equality and social change for the advancement of the lives of all people. Whereas as a thinker and a doer, Ali promoted confidence, dedication, respect, and love for all people. And whereas a role model, Ali left us with lessons that pack with humor, truth, suffering, such as a man who has no imagination has no wings, and he who is not courageous enough to take risks will accomplish nothing in life. And I wish people would love everybody else the way they loved me. It would be a better world. And you lose nothing when fighting for a cause. And my principles are more important than money or my title. And whereas Muhammad Ali once said, I should be a postage stamp. That's the only way I'll ever get licked. So I would hope that the city, I would hope the city would move forward in supporting and writing a resolution with the city of Louisville to support, to get a United States postage stamp in honor of a Kentucky native. So
Yeah, I think that's a great write-up on them.
Yeah.
I've admired them.
I thought they did a great write-up, and I think that's something that we can start with here in Frankfort, and whatever history that we have that may connect, that we can add an extra whereas or something of that
Well,
nature.
maybe the
But
Capital City Museum could offer something.
yeah, definitely.
And
So-
I like the one about the butterfly and sting like a bee.
Yeah, yeah. So I would just like for us to be a part of that, and hopefully one day that we'll be able to, I don't like to lick my stamps, but put a stamp on that would be in memory of him. So
Any other?
that's my,
Yes, Commissioner Mann.
At some point, I would request a presentation, maybe just educational, from Kentucky River Authority as we continue to talk about prioritizing river development. I myself would like an opportunity to just kind of understand what their involvement may be as we move forward with that and have an opportunity to ask questions.
I think that's a good idea.
And I'll follow up all of these with all of you all for the will of the board.
Commissioner Rosen?
So I'd like to introduce the idea of having a 5-cent bag fee. So this would be a program to reduce the number of single-use plastic bags. And it would benefit the city financially from a number of standpoints. First, there'd be less trash going to landfills because people would be reusing bags. It would keep bags from clogging watersheds, and we want to use the river more, seeing plastic bags lying along the edge is unsightly, and it's hard on wildlife as well. Also, it would help the sewer system, just not flowing into the sewer drains. I see them floating around on trees, on roadways, and it would keep them out of those areas because there'd just be fewer bags. And also would help with sewer processing, where we all saw as the sewage comes in and they take out the chunks, bags clog up that area and they have to clean that out. And the same thing for recycling, that they have to stop the recycling conveyor belts to take out plastic silverware, straws, and plastic bags, which are just horrible. And I do a casual survey if I'm out on a walk and I find some cans and I see someone's recycle bin, I plunk them in there. And I often see plastic bags of plastic bottles and cans in the recycle bin, which is not where it should be. So if people actually thought when they make a purchase whether they need a bag, and it encouraged them to use reusable bags, that we'd be ahead. And looking at different programs, the 5-cent fee seems kind of standard, and the idea that the retailer can do whatever they want with that money. They could use it for charity, they could use it for investing in their signage that they would need to say we're charging a 5-cent deposit, or not deposit, but fee. And I think it would be also something that would easily fit into our goals of a more sustainable environment. So,
Consider it.
I will follow up, and from what we discussed before, and it is true, it falls under sustainability of our strategic plan, but I would also offer that the activities that we have, if we, and following up with you all, if this is something you want to pursue, then we'd have to balance out with activities that we have planned to pursue, that then something else would need to wait, just in balancing out workload on the staff, or if there's additional research, or, you know, outreach to businesses, or, you know, public outreach, you know, different things, that timing to balance out with our other workload, or to then take off something that we were doing, you know, we were planning to do, that might be postponed. But if it's the will of the board, we're happy to pursue it. We just might have to look at some other activities that would not be able to occur maybe this year, would have to be postponed.
I think that's a good point. I do think that there are a number of ordinances out there. You can easily find them on the internet, so it's not like we'd have to write it from scratch. And that there are exemptions for people in SNAP program or other low-income situations or handicapped situations that could be exempted from this. So there are ways of looking at it, but it's a lot of states have adopted, or not a lot, 9 states have adopted it statewide, and I believe about 15 states have various cities that have adopted things like this. So it's not unrealistic, and we wouldn't be the first.
No, I agree. There's a lot of examples out there. I think of where the time is that if this is what we want to pursue, then there's got to be a lot of engagement with the community, engagement with business, education, also probably thinking of some programs. I know of other programs that have offered free, like, reusable bags as a way of doing that work. That's probably where I see there would be a lot of staff commitment. So just as a balance out.
I just have really quick. I just wanted those to know that we are looking into Home Street. I know that I've had a meeting with city manager on Friday and regarding Home Street and some of the potholes and things of that nature. But we have the C-Click fix now, so you can also do that. But we're looking into that because we are looking hopefully for the Home Street corridor to go through. But what can we do in the meantime to try to push the state to fix that road and let them know just something in between. So we are looking into that, so we're not overlooking you. And then also, I just wanted to say, let's not forget about the block party that Blair is putting out. So she just put out that information. So on September 24th at 9 a.m. to 12 p.m., we're going to have a block party to celebrate the 2nd Street corridor finishing, ribbon cutting. I believe Blair said at 9:30 the ribbon cutting was actually going to happen, but the event's going to start at 9. And there's going to be food trucks and I think music and a little bit of everything. So come out on September 24th from 9 a.m. to 12 p.m. right out here on the 2nd Street and enjoy some family fun and ribbon cutting to say yay to 2nd Street being complete. So come on out. That's all I have.
That's it?
Move to adjourn.
Second. All those in favor to adjourn, say aye. Aye. Now adjourned.
I just knew that